I just think it's rude, ignorant, thoughtless.
Your risks far outweigh the benefits.
It's up to me to weigh up the circumstances that I'm prepared to risk.
I just need to have my testicles checked. When I swing over, they sort of go glump.
You're in pain, Mum.
Doctor, can you put your thing up my bum, see if I've got a lot of poo up there?
I mean, if I was going to go, fine. But I don't want to find I'm going to spend months almost like a vegetable.
There are some risks of people having a stroke. The worst case would be that you didn't make it through.
Yeah.
Good morning, Putney Mead. How can I help?
That will be Dr. Neil, and that will be between 9 and 11 this morning.
We've got one appointment left, 8:38, that's doing well. I remember sometimes for 8:09, we've booked it all out, literally.
So, because we've got a bit longer, what I've done is sort of made a bit of a list of things to talk about. So, why don't, before we go into that, were there other things that you wanted to talk about today?
Doctor, can I ask you a question? If a woman is married to a bloke and he beats her up, like black and blue, right? And she comes and sees the doctor and he says, where'd you get that? And you said, is your husband beating you up? And the mother, turns around and says to the doctor, yes. Can the doctors do something about it?
Why did you ask that?
Can they do that, doctor? I know everything's changed now.
What makes you ask about that now?
No, it's... I wanted to ask you.
Well, of course, we could always help.
I wanted to ask you, didn't I, Richard?
Yeah, because we was
I like
that trial and retribution.
It's like...
It's always like this, Doctor. A man shouldn't hit a woman and a woman shouldn't hit a man. See, so...
No, we've never done nothing like that at home.
No.
The staff have been very good.
Yeah. Okay.
Anyway.
But you two are all right?
Yeah, fine.
Yeah.
And you said you was going to mention the doctor earlier about your bum.
Every time when I eat something, it goes right through my stomach. It gives me diarrhoea. And my bum has been very sore. I've been wiping it, but it's been very itchy.
Okay.
And when I go, I pass wind in my bum.
Yeah. What about pain in your tummy? Are you getting anything?
No.
Does your tummy get bigger, have you noticed?
No.
No, it doesn't sort of puff out.
Yeah.
Okay. And from what you've said before, it sounds like there hasn't been any blood in there or anything.
No.
No, good. Okay.
No.
Fine. Is it better when you're not going to the loo so often?
I know when I do a big poo, my bum gets very sore.
Yeah.
Oh, it's very sore.
Okay.
You have to give it a few flushes before it really, gets rid of it.
Yeah. Yeah.
You know what it's like, Doctor.
I do.
Yeah.
Oh, dear.
Hello.
Good morning.
How are you?
Not good, not good.
Oh.
I had the worst cough and cold I've ever had in my life.
Did you?
I had paroxysms of coughing every few seconds. In the end, I had to just hold my mouth shut and just cough internally. because it was tearing my lungs apart. It's a cough that comes from down here. It's not a light cough. It's really a hacking cough.
Right.
I call it my graveyard cough. You see, it's very difficult for me, and I don't really expect you to believe this, but the work I'm engaged in, there's a lot of occupational hazard.
What is it you do?
I'm working in a healing ministry, it's Christian healing ministry, and of course it overlaps a bit with what we call the deliverance ministry.
People will go off on tangents often when they're talking about their problems, and actually it's not really, not all of it is very relevant to that particular problem. Although they may think it is very relevant, it doesn't help us diagnose, we make a diagnostic decision really about what the problem is.
When you go into the enemy's territory, he doesn't like it. And the devil is extremely clever at coming in under disguise. I mean, this morning, I just suddenly felt so ill. And then I thought, oh, this is just his back to his tricks again. And I find that it's what I call an attack from the other side. It's not a genuine thing. Right, well, with regards to your cough, I'm just wondering what the next step should be.
I didn't really address it. It was one of those moments where you just think, well, that's a bit, I don't know where I'm going to go with that. Sometimes one of the medications can cause your ankles to swell,
yes,
and one of them can cause a cough, so I'm a bit reluctant to increase any unless we need to. Yeah. Now, I think the sensible thing would be to check your blood pressure again in a couple of weeks, and then we can make a decision. Yeah. Okay. Well, thank you very much.
Good morning, Putney Mead. Rachel speaking.
My stomach's growling already. It just went... Can you get me some peanut biscuits and a packet of McCoys or something, please? Thanks. Bye.
Oh, is it one of your homemade concoctions?
Well, me and my mum made it.
Oh,
yes.
what's the big bit?
Come in, have a seat. Nice to see you again. Yeah, how are you?
Yeah, good. Yeah, well, yeah. I really just want to renew my medication, really, and
yeah.
But I've got a bit, I must admit, Dr. Vajo, could you help me out with something to sleep, please? Because I think I'm sort of, I know my brain would just want to let me sleep, you know what I mean?
Okay.
I was sort of becoming a bit insomniac and only getting sort of a couple of hours, you know what I mean?
Okay, why do you think you're not sleeping?
My brain just won't let me, you know what I mean? There's too much going on, like, I'm trying to close my eyes and I'm not happy, you know what I mean? No.
Anything in particular going on in it that you think might be stopping you from sleeping? Is there anything upsetting you or stressing you?
Probably, yeah.
Okay, and what do you think those things are?
I can't put a finger on it, you know what I mean?
Can we just check you over a bit? Is that all right?
Yeah, sure.
All right, okay. Just want to take your jacket off for me. Just undo that for me.
I can't. I can't.
So you're living in a tent at the moment?
Yeah.
I think I've got that. That is it.
My dad's a dentist, and he suggested maybe having metronidazole.
Okay. I think there's always a strong argument if things are improving to hold off. Metronidazole is not the nicest drug.
I actually wanted to see if I could get some amphetamines.
I wouldn't necessarily be happy to prescribe sort of amphetamines.
And how about steroid injections? Have you?
I want to do the hyaluronic acid or whatever it is that they're doing. That's what I want to do.
I appreciate if you can prescribe me with some diclofenac.
Okay, I'd probably just use paracetamol and ibuprofen.
I prefer not. Diclofenac is the best solution for me.
Take a seat.
Right. Yeah, the reason I come to see you is out of the blue, they stopped my climber valve.
Right.
Now, I knew nothing about it. Was stopped because I should have seen some in March. Nobody told me I should see someone in March with this electronic stuff. How do you know?
But the pharmacist should be relaying anything that we pass on, so that it's because it's a new thing. I think there will be some hiccups. So I'm really sorry if it hasn't worked out for you.
But then I've also been attending this surgery more than any time in my life, probably, and I just think it's rude, ignorant, thoughtless to actually stop something without even telling me.
It was stopped in June.
But you see, because I only take one every other day, Dr. Andrews, I wouldn't have ordered them since then.
That's absolutely fine. But as responsible prescribers, we have to know that you've understood the risks of being on HRT at this stage in your life, and we have to document that. So, you know, your risks far outweigh the benefits at this stage when you've been on it for this long, and that's what all the research is saying and continues to say. So I think it's really just so that we can be sure that you understand that staying on it increases your risk of breast cancer, increases your cardiac risk. There are other, you know, it does carry risks with it.
But so, I think it's up to me to weigh up the circumstances that I'm prepared to risk.
It is entirely up to you, and our job is to be absolutely certain that we just keep reminding you what those risks are, because that's what our job is. So it is entirely up to you. I entirely agree with you, but that's what that's about. That's what's happened. So
well, if I'm
I can
told,
reinstate it. So I'm not going to put this in your Dosset box in that case.
Right.
But I'm going.
Oh, that's right.
Yeah, exactly.
Just leave it to me to order it. Excellent.
Good.
Anyway, lovely to have met you.
And you.
Dr.
I'm glad we
Andrews.
managed to sort that out this
afternoon.
afternoon.
Because I came in here absolutely. I had steam coming out of my ears. I really did. And said that I was going to sit downstairs and sing "I Will Not Be Moved" until I saw somebody.
She means it.
Hello, Putney Leeds, Lorraine speaking. How can I help?
Hi there, you okay?
My GP surgery doesn't do injections, they don't do blood tests, so actually this is an exceptional practice, to be honest.
How much do you normally drink in a day, Stephen?
3 or 4 strong cans a day, I suppose,
And any thoughts of cutting back on your alcohol or getting a bit more help with it, or does your outreach worker help you with that?
Well, it is from a drug and alcohol organisation, sure.
Have you got your outreach worker's number?
Yeah, I have.
Can I have it?
Yeah. Yeah, his name's Charlie. Sorry, mate. No,
do you want me to do it?
Yeah, if you can.
Yeah.
Yeah, you can do it. Oh, someone's right. Oh.
That's him.
Yeah. Is that Charlie?
Yeah.
Can I talk to him? All right, Charlie.
I can speak to him, actually.
Okay, no problem.
I can speak to him, actually.
Yeah, sorry, I'm with my doctor. He'd like to talk to you.
Oh, yeah, okay.
Yeah, I'm here now. Right. Okay. There you go.
Hi, is that Charlie?
It is Charlie, yeah.
Charlie, hi, I'm Dr. Buveja. Stephen's just turned up to see me today. I was actually just asking him to get me your number. I'm sure you might be a bit busy at the moment. Do you mind if I give you a ring maybe in the next couple of days? Is that all right?
Oh, that's fine. Yeah. Give me a call tomorrow.
Yeah. Cheers, Charlie. Bye.
Bye.
Is it all right if I talk to Charlie about it?
Yeah, of course. Yeah.
All right. I think today you seem a little bit like as if you might have had quite a lot to drink.
I've had a bit to drink.
Yeah?
Okay.
Will you make an appointment to see me in about a week? Is that all right?
Okay.
And maybe next time just come with a little bit less alcohol on board, if that's all right. Just so that I can understand you, really. And that we're not jumping around. Is that all right?
I know where you're coming from. Right.
Thanks very much.
All right.
Cheers.
All right.
All right.
Lady needs an urgent appointment, so I'm going to put her on now.
Doctor, would you do me a favour? Can you put your finger up my bum, see if I've got a lot of poo up there?
Well, I think it'd be helpful, actually. Yeah, let's do that. Just relax, Teresa. Well done. Sorry. Well done. Good.
Good boy.
We'll talk about it in a sec. So get yourself dressed first, and then we'll have a chat
Is my
about it.
bum sore?
Doesn't look too bad, actually.
Have I got poo up there?
No, nothing that I can feel in your bottom, but it doesn't mean it isn't higher up in your tummy. So I'm just going to have a look at the computer to see if we have that X-ray of your tummy, all right?
All right, love.
Yeah, so hold on a sec. No. You do have to go to Queen Mary's for your X-ray of your tummy.
My tummy?
Because an X-ray can help us when we're wondering if there's lots of poo in your tummy.
Yeah.
I think that'll be a helpful thing, because I'm trying to get a reason why sometimes you're having these runny tummies, really.
Yeah.
Is that all right if we get that done?
All right, love.
Okay. So get them to make the appointment for the blood test and for that thing. Okay.
Oh, thank you, doctor.
That's the blowing test. There you go.
Oh, thank you, doctor.
And do you, what soap do you use?
Well, I use a body wash, my darling.
Because I think your soap maybe dries your skin out a bit.
If it gets bad, I'll have to come to you.
Okay.
Yeah. I like your jacket, by the way.
Thank you very much.
It's nice, isn't it?
Richard, leave Dr. Ernest's flowers alone.
Okay. All right then. I'll see you soon.
All right, Doctor. See
Take
ya.
care, Richard.
Bye.
Bye-bye.
When I grow up, I will be a doctor.
Do you? Yeah. Oh, it's a very interesting job. You get to meet lots of lovely people. Oh, oh.
Warm this up, shall we?
Hello.
Oh, you're quite heavy. If you open up nice and wide for me and say ah. Say ah. Hello, sweetie. Is it a bit tickly?
Yeah.
Is that a bit tickly?
Yeah.
Come in. Hello, Mr. Hart. Hi, come on in. Hi there. Come on in. Right. How can I help?
It's just sometimes I get palpitations and I get the odd dull pain in my arm.
Can you describe it?
Just like a dull ache, really.
Look at that helicopter.
It's like a headache feeling, but except in your arm.
And how long would it last for? Is it all there all
A few
day?
seconds.
A few seconds.
A couple of minutes.
Couple of minutes. Okay. And what are you doing normally when it comes on?
Right, can you and let me talk to the doctor? I just ignore it. Just getting on with things.
Okay.
Ashley, please.
Ashley.
Ashley, right. You've been warned so many times now.
Probably you
Right,
should.
now,
maybe
come and
not
sit
touch
down here now.
Thank you. Sorry. So
I was recently diagnosed with a hiatus hernia that came up in a chest X-ray.
Mum, I think there's going to be a storm coming.
I can't concentrate. Please, can you be quiet?
Look, I think there's going to be a storm
No.
coming.
probably right.
It's not. It's going to be sunny until Saturday. Right, can you stop?
There's lots going on, isn't there? How are you managing?
It's tough, but I manage.
Managing.
I've got gallstones, as you know.
Yeah.
I've had history of gallstones.
Right.
And I've also had history of heartburn.
So, and what was it that,
indigestion.
if you've had this as the same pain for some time, what was it that made you call up today specifically about this pain?
Because I keep feeling lightheaded.
When did that start?
Just this week.
All right. Has anything else changed recently?
No. Ashley, please.
Some consultations are completely chaotic. And that can be because of the GP, the things that the GP is dealing with, or the patient's, the chaos of the patient's living. And you can literally see it playing out in front of your eyes in the room. It's quite difficult to keep focused. And I'm always worried that I would miss something. And that's often where the discomfort is for me. I actually think it might not be a bad idea to get some tests done to rule out the heart as a cause of this, okay? And actually, probably the best way to do it would be through the hospital for the cardiologists.
Oh, okay, yeah.
All right, so you'll hear from them.
On there, yeah.
Blood pressure and the pumps.
Brilliant. Thank
All
you
right.
very much.
Look at me. Look at me.
So I think I do keep my cool, but I worry that I've missed something. As people walk out and as the chaos leaves, I'm always left thinking, you know, what have I just missed? There's something else there.
Hello. Is it Mr. Morris?
Yes.
Hello, I'm Dr. Ernie.
Yes, good morning. I usually see Dr. Andrews.
Yes,
We have
I
a good
saw
relationship, but this is a man thing.
Okay.
It's not a matter of embarrassment, it's just that
Yeah, that's fine.
she doesn't have a penis and you do.
Okay.
I just need to have my testicles checked. They feel swollen.
Okay.
They feel heavy. So I noticed it 2 or 3 weeks ago during warm nights when I sleep naked. When I swing over, they sort of go clump,
Okay.
you know.
Yeah.
There's a slight pain at the root, as though being pulled.
2 or 3 weeks you've noticed this?
2 or 3 weeks ago, or just realising, you know, it's a warm night, but penis, as you know, gets very floppy, but it felt more floppy than usual.
You've also written on here low libido.
Yeah, I'm just turned 75. I've not had a sexual relationship for years, so if I do masturbate, it takes some time to get anything more than a...
Really? Okay. Yeah.
I mean, I've been giving it more attention because of this. So.
Yeah, no, of course. Have a seat up on the couch.
What's your date of birth?
You're very welcome. Take care.
And the name?
Archie. Oh, I love that name, Archie. Hello. Could I have an appointment, please? I'm sorry, he probably doesn't sound anything like that. No, he doesn't. He's only born in 2003. Hello, it's Archie.
How are you getting on?
Since I last time saw you, I'm out of tablets for blood pressure.
When did you run out of tablets?
A couple of weeks ago. I've been a bad boy for the last 2 weeks.
Yeah, well. So, and how are you feeling in yourself?
I think so I'm feeling much better.
Are you?
I'm feeling much better.
How are the stresses? Do you remember last time you were going through a lot of stress?
Comes and goes, you know. I think it's my nature. I can't let go things quickly. I want everything perfect in my life, you know, especially in the business, you know.
Okay.
So if something is off a little bit, I get very uptight.
Right.
With my staff and all that.
Okay.
And lots of my friends have said to me, Ash, you need to chill out.
I mean, we had this chat before.
Yeah.
You're putting yourself at a very high risk.
Yeah.
I'm being serious because actually we're not talking about 10, 15 years down the line. If you carry on like this with these readings, blood pressure, with that lifestyle, heart attacks and strokes are a very real possibility for you.
Pinch your nose and blow. Keep blowing.
Keep going. Keep going. Keep going.
I had something that was similar to asthma.
I always have been suffering of coughing.
Are you bringing up any phlegm?
A what?
The muscles that line the passageways of the lungs, they tighten up.
We need to try and get the asthma under control because at the moment it's not ideal.
Oh, you are wheezy. Got a little orchestra going on in there.
How will your wife manage if you have a stroke?
Difficult. I've seen people with stroke, and I have an uncle had a stroke nearly three years now, and he's in a home care, and all his money, what he's earned, is going in, being looked after. Can't move, can't talk.
Okay.
He's like a cabbage sort of thing. You know, I've seen a friend passing away, so I think.
So you've experienced it close up.
Experience, yeah.
And so I think we need to do make some changes now, and I agree, and I would support you. We talked about work stress.
Work stress is biggest problem, and then another one factor is my dad living with me, and it's getting a bit. I know he's 89 years old. It's my responsibility to look after him, but it's just getting sometimes a bit irritating, you know.
Okay.
Sometimes, you know, he makes a lot of mess in the kitchen, and when I see it, I said, "What is this, Dad? Come on." Things I tell him, don't do it. Just leave it there. He keeps on doing it and makes a mess, and that boils me up, you know.
I'm just wondering what might help you. What techniques could we try, or could you try, to stop yourself getting to the stage where you just boil over suddenly, going from nothing? You're not going to be able to change him.
No, there's no way I can change him, you know.
But we might be able to focus on how you change how things affect you.
Yeah, okay.
Because I think that's where we could start.
Okay.
You can't change him, but how do we change the impact on you?
Okay, all right.
So you're in the same situation, but you approach it differently.
Okay.
I mean, there are other options. We have other options. If you're getting very stressed with this issue, you know, we can always think about a few sessions of counselling where you can just explore this with somebody who's not related to your family, and you can really work through what options you have.
Okay.
And I think we need to do this together. So what tablets do you need today?
I need the whole, everything.
And then can you have a think over the next 2 weeks, between now and when we touch base, what else might help you to manage the stresses?
Okay.
You know, just have an ideal world. What would help you? What do you need to do? What do we need to focus on? We'll do the blood pressure, but what else might help you to focus on the stress?
Okay. All right.
Yeah?
Okay. All right.
Between us, I think we can then get there, because otherwise, all of the stuff I do is not going to be worth it if you're going to go off.
I understand that.
do
It's
that.
not. It works both ways.
Yeah. So if we're happy to do that.
Yeah.
Hello, Putney Mead, how can I help? Do you want to go and take a seat on the first floor?
Mr. Ackerman.
Doctor, how are you?
Fine, thank you. Nice to see you.
Nice to see you.
Right. What can we do for you?
I've had an operation on my ear. He had to rebuild my eardrum.
Okay.
Completely. When I came out of hospital, it was brilliant. I was jumping up and down. I could hear with both ears. But I had an infection, and ever since then, it's been driving me insane. Doctor, I am having a hell of horrible time. And I get the most throbbing headache, the mother of all headaches, I kid you not. And it hurts. It really feels...
Is there pain in the ear?
Yeah, everywhere. I get it all over. All over. It makes like a bubble noise. Brr, brr. Do you know what I mean? It's driving me absolutely insane. I wish to God I'd never had the operation. I really do.
Right.
Now, the past couple of weeks, I've been losing my balance.
Right.
Nearly fell a couple of times. I'm a chef, you see. And I'll be honest with you, Dr. King, I'm very, very worried because I use twin fryers and the temperature is 190 degrees. And if I fall head first into one of them, it might as well serve me on a fish and chips as well, or whatever.
I'm just feeling for any lumps in your groin there. Okay. So I'm just going to check your penis as well as your testicles. All right. And where's this pulling discomfort that you get?
It's really at the root.
So I'll just examine your testicles, okay? Good, that's fine. Would you mind if I examined your prostate?
Yeah, what does that mean? Putting
So
your finger up my bum?
Yeah,
Yes.
that's right. Is that okay?
Yeah.
So the way to do it is roll over and face the wall.
Yeah.
And well done. Deep breath. Oh, that's it. That's fine. Why don't you pull up your trousers and come and have a seat and we'll talk it all through. Let's have a look. That was in the past. Okay. Your testicles, from my point of view, feel normal.
Right.
And your prostate felt fine. Slightly enlarged, but a normal shape. And what's reassuring is
they feel normal.
They do, exactly. With testicular cancer, if it's causing a heaviness to the testicles. They do feel remarkably different actually from normal. They really feel very heavy from our point of view. So the fact that yours don't feel like that and they're a normal shape, no extra lumps, is very reassuring. In terms of the erection change and the low libido, it might be worth checking your prostate blood test, but also your testosterone, just to make sure there's no sign that either one of those is abnormal, just as a so that we're covering all the bases, really. Okay?
Yep.
All right.
Thank you very much.
Not at all. Nice to see you.
Stop me if it's sore when I'm doing this, okay? It's still wet and red. And
Sorry?
It's still wet.
And red.
And red, and
Very red.
there's exudate covering it. We'll take a swab, but we also need to do something as well. We can't just leave it like that. Let me just touch this on the inside. Sorry if this is a little bit sore. Sorry. Sorry. Okay, all done.
Did you see a small little hole in there still, no?
I can't see the eardrum. It would be better to have you seen by the surgeon that did the operation, but it's not a complicated problem. It needs to be looked at, and it needs investigation. So I think that is probably the way to go. That we can get you seen in that clinic.
Can you give me tablets for it or anything to?
We can give you some tablet antibiotics.
Yeah, that'd be nice if I can hit it with that. So I'm amoxicillin, yeah? We'll hit it with that.
We'll try.
Yeah, no worries, Doc. You
No
guys
problem.
do a great job, so, you know.
All right.
Thank you for your time.
No problem.
Lovely to meet you.
And you. Wrong way.
Wow.
That way.
Do you know what when's the skeleton then? Do you know why? I think it's the chemist. Hello. Hi, can I pick up a prescription, please? Hello. Hello.
Hello. How are you doing?
Oh, well, not doing very well at all. Really, I'm getting out of breath. It's all seemed to have happened in the last month, really.
Just getting worse.
I'm not sleeping well. And in fact, Saturday night, I just couldn't breathe.
Have you seen the surgeons yet?
Well, they said my ventricle in the heart was closing up slowly, and that was why they said I should go see about having something put in to widen it up again. And I assume that's causing all the shortness of breath suddenly, is it?
Yeah. Well, if they do surgery, they will probably try to do it as minimally invasive as possible. So they might do it by going in via the wrist or via the groin and trying to open up the valve that way.
Yeah. I mean, if I was going to go, fine.
Yeah.
But if I'm going to find I'm worse off,
Yeah.
you know,
There are some risks of people having a stroke and things like that during this type of procedure.
yes.
The worst case would be that you didn't make it through.
Yeah.
But I think if you do nothing, I think your symptoms are steadily becoming quite a lot worse, aren't they?
I felt I needed to make him aware that, you know, his illness is a life-threatening condition, and the natural process of that condition will be that he will steadily deteriorate and eventually die, albeit in an unpredictable time frame.
What do you think? If I didn't have it done, probably what? I've got about a year?
I think that's notoriously such a difficult thing to be able to predict, I think.
Yeah. I mean, my main thing is not so much going, but I don't want to find I'm going to spend months almost like a vegetable.
Doctors most certainly should not always intervene to save a patient's life through treatment. It completely depends on the individual situation and the individual patient, of course. In medicine, we always try to do good and not do harm. And so in some cases, intervention can cause more harm than good. And if they choose to decline a treatment, then you have to respect their wishes and respect that that's their choice.
I think we just need to really await this appointment with the cardiothoracic surgeon.
Yeah, and if anything, obviously, it suddenly gets worse, I suppose,
if if things become, very critical and that overnight, then, 111, or if you feel it's a real dire emergency, then 999.
Yeah.
Okay.
Yes. Okay. Nothing I can do about it, is there? Yeah.
When the time comes, whether I will have intervention or not, I think it is it very much depends on the situation, and I think until that time comes, I can't probably easily predict my decision, but within reason, I'm sure I would mostly want something done, if at all possible.
All right.
Okay. Thanks for your help.
You're welcome. Take care.
What can we do for you?
Okay, very simple. I have a hemorrhoid, and it's excruciatingly painful. Yes. Yesterday had some spots of blood on toilet tissue.
Okay, you've had these before, presumably, or
many years ago.
Right.
Yeah.
And you're fit and well otherwise?
Yes.
Should we have a look?
You can. Yeah, I've had a shower.
Fine.
I'm going to Italy next week, and I just thought, please go.
Yeah.
Just go before I go to
Oh, yeah, okay. I'm just going to... Just tell me to stop if it's too tender. I'm just going to put a finger inside. That is a nasty pick. It doesn't actually look like it's thrombosed yet, which is what happens sometimes.
Right.
When they get sort of clotted and then they become sort of almost permanent. Right, you get yourself dressed up and decide what to do. Now, when are you going away?
Tuesday.
There is a sort of rapid access, or sort of piles clinic, if for want of a better word, that runs at St George's. It's on a Thursday, as far as I remember.
I'll be gone.
Be gone.
Yeah. Yeah, I'm going to. We're going to southern Italy, Bari. Do you know it?
I don't know. Sounds nice though.
And whilst we're there, I'm proposing. So we shall see.
So you really want these under control, don't you? Is it all planned then? Have you got a?
Yeah, bought the ring. I thought I'd just go for a nice stroll across the beach, and then just go down on one knee as the sun's coming down, and if it all goes well. And if it doesn't, she's going in the sea.
Okay, so I think the thing to do really at this point is to treat it as much as you can.
Okay.
Now, it's on the sort of anal verge, so it's partly in, partly out, and as far as I can examine, there was a suggestion of some little ones slightly higher up as well.
Right.
So what I will give you is some suppositories.
Yep.
And some ointment as well.
Okay. So what do I do with the suppositories? Just push them off? Delightful. Right, okay.
All right.
Yep, thank
well,
you.
I hope it settles down.
Okay,
all right.
wonderful. Okay.
Bye now.
Have a good day.
And you.
There was this
Can't be
woman
bothered.
came in and she wanted to register her unborn child. And I was like, well, if it's not actually like on the earth yet, I can't like register it. And I was like, wait till it comes, you know?
Come in. Come and have a seat. Okay. So you've had a rough few days, haven't you?
Yeah.
What does the pain feel like to you?
As if I've been beaten.
Really?
What about when you lay down? You can't lay down.
I can't
'cause
lay
of the
down on
pain.
my back. I can't put my back down.
Do you want to take your jacket off?
Yeah.
And if I press... Oh,
yeah.
It's sore, isn't it? Oh, it's sore all along there, isn't it?
Oh, yeah, it's bad.
Goodness me. Do you want to lie down? You can show me where it hurts. Might be useful. Because obviously we know you've got osteoporosis and your back is curved. I mean, sometimes you can get little fractures in the spine. Where's that hurting you?
Oh, right across there. Oh, you see.
Let me know if I hurt you.
Ow.
You won't enjoy this too much.
Oh, sorry.
Oh, that's the hardest part.
dear
I had the constant pain in this area.
The pain goes from side to side.
Blimey. I feel so ill.
Oof. It's a cyst. I won't do any more.
Pain is bad. I'm in a lot of pain.
I can see that.
Oh!
Where's that sore?
All across there. See, I've only got to move. I can't go on my back.
No.
Because of it, but it's hurting across here.
Pain at the front.
Yeah.
It's difficult for me to sleep in and everything. Oh! And then it's agony.
There's obviously pain in the chest there, which looks like it's coming from the muscles and the bones rather than coming from the lungs. Well, it's difficult to know. I mean, you can get an inflammation of the cartilages there called costochondritis. It's like an inflammation of the costal cartilages, basically. Come on, you sit up, make yourself comfy.
See, I haven't got any movement like that. I'm in agony all the time. I went to the hospital, but I mean, they weren't particularly bothered.
They were bothered, Mum. That's why they gave you the painkillers and the antibiotics.
But you've no idea the pain I'm in.
We do.
I can see.
It's all so depressing. Oh! See, it's only that I sort of pulled myself up and
it gets you. There is always the possibility of, Queen Mary's Hospital has Bryson White ward, which is like a rehabilitation type ward. If we're finding it difficult to manage the pain at home, I mean.
What about calling it respite?
I mean, is it something that you would consider?
don't know.
You're in pain, Mum.
I don't want to go in hospital.
But it's not like going into an acute hospital. It's it's like it's more of like a rehabilitation type unit. Mrs. Emanuel I've known for a long time, and she is a fiercely independent lady. She always comes in looking immaculately dressed. Her house is immaculate, and I think she's very proud of that and wants to be at home for as long as possible. But things had really come to a crisis point because, unfortunately, she's recently been diagnosed with Alzheimer's disease, and we weren't sure whether she was remembering to take her painkillers. I guess the benefit of going somewhere like Bryson White would be that we could hopefully get you better quicker.
Yes.
Should I make some enquiries anyway?
Make some inquiries.
Yeah?
I don't really want to. I want to stay in my own home.
But, Mum, you need assistance. You do need some help. At the moment, you need some help.
I mean, I think if I was in Mrs. Emanuel's position, I, like her, would probably be the same. I mean, no one wants to lose their sense of independence and autonomy, and to feel that other people are making decisions for you. I'm not saying it's going to be forever.
No, no.
So leave it with me. Am I able to get you on the phone later, John?
Yes,
Yeah.
you've got my number.
Yeah, I've got your number. All right. All right, do you want a hand?
Any movement?
Got it. There we go. Okay. See you later. Okay, see you later. I'm really proud to be part of the NHS. It's the largest publicly funded health service in the world. And it means that everybody, regardless of wealth and income, has access to good health care.
Gracias.
Thank you. Bye.
Bye.
People often ask me, well, what is it to be British? And I think the NHS is a fundamental part of what it is to be British, and something that I'm very proud of, and I think we should all be proud of.
Hot off the press, you can have it from us. I've got stage 1 bladder cancer of an aggressive type.
So
This is the speculum going in, okay.
I want to stop drinking. I just detest it enormously. I'm being honest, I cannot stop. It's as simple as that.
Let me just dip this sample in.
Yeah.
Keeping it really simple with left hand. Yeah. As you find right hand is... it's mentally exhausting even just to do that.
That's all right, we'll find you on the system.
How can I help?
I've developed a rash.
Right.
Pretty much all over my body.
Right.
So this happened on Monday night, was the first time I noticed it.
Okay.
I'll let you look at it, but
Yeah.
it looks a bit like chicken pox.
Okay.
But it's not chicken pox, I'm pretty sure, because I've had that.
Right.
But it's very much like...
So, let's just have a look. So, it's quite flat to the skin, but it's not itching.
Yeah, it's not itching.
And did it all just come up, or did you start with one spot?
No, it all came up.
It all just came up and it's not itching you at all?
The first time I spotted it was Monday night when I was going to bed. So I've been taking antihistamines for a couple of days.
That's not helped
It's
at
got neither
all.
worse nor better. It's
No.
just...
And also, so if it was allergy, you'd expect, A, it would improve with antihistamines, or B, it would be very itchy, but it's not itchy. Infection-wise, you don't have a fever, you feel well, you've not had a sore throat recently, or any infection like that at all. I might see if I can pick the brains of Dr. Mackenzie next door, who's our skin guy.
Yeah.
Do you mind if I just quickly see if he's around? I won't be a second. Can I just really quickly pick your brains?
Excuse me.
Right, so there's a gentleman here with this is Dr. Mackenzie,
Hello there. Hi.
with a 5-day history of a rash. Started on Monday. It's not been itchy in any way. It's not responded to any antihistamines at all. And you're not on any medications?
No.
No.
Didn't start as one batch.
I thought I asked that.
Came Monday night, took my clothes off to get ready for bed, and I was covered in it.
Right. You know, they're all
see.
sort of leaf-shaped.
Yeah.
One has to ask the question, no risky behaviours?
Absolutely not.
Good. There you go. Adults with a rash, you got to think of that.
Yeah. He's been well in himself. He hasn't had a fever, no preceding sore throat or anything like that.
I reckon that's pityriasis rosea.
Yeah.
That's a classic sort of sign there.
What, they're scaling?
Yeah, they're sort of scaling. I reckon that's what it is. So it normally take 10 to 12 weeks before it's sort of completely gone.
Okay.
You know, no creams will really make it better. Okay.
Brilliant, thank you. Okay, do you want me to print you off a little information leaflet?
Yeah,
about
that'd be helpful, yeah.
Yeah, the rash, there's a nice photo of it here. That's probably
That looks very similar.
quite similar, isn't it? Not contagious, so won't spread to other people.
And so just expect it to kind of disappear over the next number of weeks.
Yeah, 2 to 10 weeks, but can last as long as 5 months. But hopefully it will be sooner than that.
Don't plan to go on any beaches between them.
No, just cover it over.
I swallowed, do you know how many
put
tablets?
in your car?
13 a day.
Really?
And it's driving me potty.
Oh, that's a lot, isn't it? Yeah.
My cat licks me because it's salt and he makes his fur soft.
Oh, really?
He's a Persian.
I think once I go to just having to do the Wednesday one, it's fine.
It'll be all right. Come in. Hi. Charlotte, is that right? Hi, I'm Dr. Rose.
Nice to meet you.
Hi. This is Laura. She's a healthcare assistant who gives us a hand. So...
Time for the coil.
Be looking forward to it.
Dreading it.
I know it hurts.
Because you've had it done before, haven't you?
Yeah.
You're keen to do the same thing again.
Yeah, although it hurts for the first, I found for 2 weeks afterwards, then for 5 years it's absolutely fine. So it seems like the best option of a lot of them.
So this is the coil that we're fitting, so this is what it sort of looks like. Basically what we do is I'll use a speculum, which is the thing that opens up your vagina so we can see your cervix, and then what I'll do is I'll remove the coil that's there at the moment.
Okay.
We have to go through the things that can go wrong. It's very unusual that anything does, but we just need to explain what can happen. No contraception is 100%. There's a tiny risk of pregnancy. If you were to get pregnant, then the pregnancy is more likely to be in the tubes rather than in the womb.
Someone told me their friend was born with, their friend's baby was born with a coil on their head.
Yeah, it does happen.
I've heard of something.
The worst thing that can happen to me as a doctor during a coil procedure is if somebody faints. This isn't uncommon because when we're fitting the coil, we stimulate a nerve, which makes it more likely for patients to faint. Because we can't see into the womb, there's a small risk of passing the coil through the wall of the womb. Sorry, I know this is the worst thing to tell people, isn't it? Just before we're doing it, but we sort of have to explain what the possibility. This is never
done that before?
Never, never. So does that all make sense?
Yeah.
Yeah. You happy to sign your?
I am. My womb away.
Your womb away.
It's okay. Hello. Register baby?
Yeah, we just called. He should see a doctor. He's sick.
I've got it. All right. Go up to the 3rd floor if you want.
Nice to meet you. Ali's house. Come on through. Grab a seat. Grab a seat. Right. How can I help?
Misha is now 11 days and totally healthy from day one, gained weight from day one on.
Great.
So, but this afternoon he started coughing and getting a bit weaker than he was usually.
Okay. How old is he? So he's 11 days old?
Yeah.
Okay. And is he breastfeeding or bottle feeding? And that's gone well?
Yes.
Feeding okay?
Yes. He never lost any weight even in the beginning.
And nappies, how are they?
He shits maybe 10 times a day, but he's gaining weight and he's healthy.
But the cough is what concerns you?
Yeah, and usually he's just totally boisterous and strong. And now he's like...
Should we have a look? Is that okay? Can you unpop him?
Yes.
And just roll just up. Now, can I come this side and you stay at the head ends? That'd be perfect. Okay.
We thought he has a slight temperature, nothing big, but...
Okay. Let me have a listen before he starts crying. This is not... Okay, buddy, let's have a listen. Oh. I know, I'm sorry. It's all cold and horrid, isn't he?
This mucus is like something related to a cold? Or?
Bear with me 1 second, let me just have a good listen.
Kate, isn't it? Have a seat, Kate. I'm Louise, one of the nurses. Rightio, you're here for your pill this morning.
I just need a repeat prescription for my pill, actually.
I just need a repeat for my pill.
Just looking to go back on the pill again. Have you had thought about any other types of contraception? I have. It's just, at the moment, I'm just carrying on this.
I did my test, pregnancy test, and it came that I'm pregnant. Because I was on mini pill, so, you know.
So you weren't planning on getting pregnant?
Not really.
No.
You all right?
Yeah. Come on, ladies, I can do this.
You'll be fine.
Come on, Mr. Coyle.
You all right?
Yeah, sorry.
It's all right, no. It would be funny if you weren't.
Yeah, I know.
So this is the speculum going in, okay?
It's like a smear test, this bit, isn't it?
Yes, yeah. So it just feels a bit cold.
Yeah.
You're doing really well.
Okay.
Sorry, do you mind if I hold?
No, of course you can.
Are you all right?
Yeah.
You'll be fine.
You okay?
Yeah. So we're going to take the coil out, okay?
So a nice big cough for me.
Cough.
Okay.
Is it out?
Yeah,
Yep.
that's out. You alright?
Hurts quite a lot, sorry.
Okay. Is it easing off? It's not what it was like when you got that sharp?
It's still quite sharp, but it's not as bad. It's kind of coming in a wave now.
Yeah.
It's still there. Is that normal?
Yeah.
Yep.
So this is the coil going in now,
Okay.
You alright?
Is it in?
Yeah.
Yep.
You've done really well.
I know I haven't.
You have. You've done amazingly.
I was practically crying. I think that's amazing.
I think it was the thought of it.
Hooray, 5 years.
Yeah.
You don't have to worry about it. Just
Thank
sit
you for
there
holding
for a
my hand.
moment. That's, all right. That's what I'm here for.
Do you feel all right?
Yeah.
The whole going into the knife sort of thing.
Yeah.
I couldn't.
Like
do it.
people who want cosmetic surgery, like who are willing to put themselves like.
Just like yeah, just needle me, just chop me open. I don't care. There's no point. It's like my boobs are good as they are.
It's exciting.
So he's a bit congested as well, isn't he?
Yeah.
When he's just breathing like this.
That has been for now 1.5 days.
Has it? Okay.
2 days, something.
Okay, young man. Let's get you up. Are you okay to give him cuddle him over your shoulder?
Yeah, of course.
And I'll just have a listen to his back as well while he's nice and settled. Just nice and settled. Just have a listen.
Haven't lost all your strength.
Is Mum at home?
Yeah.
Okay. Just pop him down for a second again. Oh, no. Oh, okay. Why don't you pop his things back on and then we'll have a chat. He certainly sounds congested when you do listen to him. But actually, when you listen to his lungs, his lungs sound clear.
Good.
So there's no sign at the moment of any infection on his lungs, and his heart rate is not much higher than it should be for his age. So I think sometimes when you have a lot of mucus at this age, because everything isn't as developed, it's difficult to clear it. Yeah. I think some of the things that might help with that is that, so generally steamy environments, I think would be useful. Some moisture in the air.
We have a thing like that. We put it
around
in
the bedroom. Perfect. That will be useful. And you can get. I mean, they're very little at the moment for. Saline sprays, but you can get sprays for the nose that helps from the pharmacy that help clear some of when it's very sticky.
They have that down here?
Yeah, downstairs we'll have that. So let's try the humidity. Let's see how this settles in the next few days. You need to keep a close eye because of his age. They can suddenly change, as you know. So if you find that actually you're struggling with feeding, the nappies are not as wet as they were.
Yeah.
Or he's still not as alert, or things are not improving. Or if you look at his chest and you see that his ribs, he's pulling in his ribs, or at the base of the throat, he's pulling it in when he's breathing, that's a sign that he's working too hard with his breathing. And that's a sign that you should get somebody to see him, even if it's in the middle of the night.
Thank you very much.
Not at all. You're right to get him seen, yeah.
Thank you so much.
No problem, he's nice and alert now. Okay. All right,
bye-bye.
Take care now. Bye-bye.
He's had a viral infection. He was never that ill, but it tickled up his airways.
Hello. Who's this? Oh, hello.
Are you ready? Oh, good girl.
So you noticed those spots first yesterday, as if you more today, is it?
Yeah, and they seem brighter.
Sometimes with skin rashes, it could be due to an allergy. Has anything changed at home? Any pets? No. Or any... Can't smell it yet. Can't smell it yet.
Meningitis is basically bleeding under the skin. So when you wipe a finger over it or put a glass on it, it doesn't disappear. Don't worry about any of that, okay?
Hi, how you doing? You alright?
I'm seeing I'm alright. I'm sorry. I feel terrible. I've got a deaf in one ear for start.
Okay.
Which I don't know why. I'm getting a noise there all the time, and I can't hear a damn thing. It's driving me bonkers.
One thing that I was quite keen to do. Remember last time you had that cyst?
Oh yeah, got
Just
that.
wanted to have a wee look at that. If that's
Well, the antibiotics seem to have worked, and it's got like a crust on now.
Yeah, I think we'll have to see what becomes of that, really. That infection has settled down and that there's no real mole there anymore or anything.
If it was a mole, I must have caught it or something like that.
Well, should we just see how it goes? We'll keep an eye.
I'll keep it. Well, I mean,
keep an eye. We're going to be meeting anyway, aren't we?
Okay.
So we can just periodically review it. Okay.
Yeah, sure.
What else would you like to talk about today? Obviously, there's a lot going on, but
I would like to get a consultation with a drink specialist to get me off the booze because I am seriously concerned.
Yeah.
Because I'm getting home now. I'm depressed.
Yeah.
I'm not suicidal. Don't get me wrong, but I just start drinking, and I can't actually just say I'll have 2 and stop.
Yeah.
Once I've had 2, that's it. Boom. I don't know what the answer is. I really don't. I know it's not doing me heart any good at all.
Yeah. It generally doesn't do you good to drink lots and lots.
Especially, I mean, I do appreciate it, but I've got no willpower. I try and try and try. It's very, very hard,
Yeah.
But I do want to stop drinking. I just detest it enormously.
Yeah. Dropped a line to that alcohol liaison.
You haven't heard from them yet?
I was hoping you might have heard from them.
Not a sausage, nothing. I'm being honest, I cannot stop. It's as simple as that.
Yeah. Okay. Alcohol services, I'm going to write to them.
Okay.
Do you want me to give you their number as well so that you can
You could do, if you wouldn't mind. Yeah.
So I'll find that for you in a sec. Okay.
Okay.
Do you want to catch up with me, in a couple of weeks?
Should I make an appointment or should I just give you a ring?
Talk on the phone if you want next time, save you a trip down.
Okay.
Yeah, and then we can see if there's anything that you feel you need to go see, and I can stick you in for an appointment.
Fine.
All right.
Thanks very much.
No worries. Take care. All right.
I'll see what I have to do about the
Yeah. All right. Look after yourself. All right. Cheers. I referred him to Drug and Alcohol Services quite some time ago now, and he was transferred to your team because he fell out of area, full stop. He's really desperate to cut down his drinking, and I would appreciate any support you could provide as soon as possible, full stop. Thank you for taking the time to see him, full stop.
Three people queuing and just me, Carol and you picking up. Good afternoon.
It's okay, it's one each.
Putney Mead, how can I help?
Putney Mead, good morning, Nicola speaking.
Susan Watts, please. Thank you. Come through. So, welcome. I haven't met you before and think you were booked in to have a health check. Is that right?
Yes. Can I just give you the history? Then it sort of makes sense of it.
Yeah.
I use my stress by using adrenaline. So I'm on overdrive the whole time. And my father shook, and when I do that, I don't shake.
Yeah.
But to eat a bowl of soup, it's impossible. And last weekend, could I stop my shakes? So the worst they'd ever be. So I think it's a hereditary pattern.
Yes, it can
rather
be.
than it being dementia or anything.
Yeah.
And I think I'm just so stressed I can't walk in a straight line. Signing my name now, you would have thought it was a spider on the website.
Okay.
So probably because I don't want to go down the Parkinson's line, dementia line, I now put in a program of exercising myself and walking much better. And I can't say in 3 weeks it's made much difference. Makes sense?
It does make sense. But it's an unusual presentation, and
Really?
yeah. What are your concerns that you think these symptoms might be?
I am concerned in case I'm pretending it's not Parkinson's, but then I read the paper today saying everybody's encouraged to go to their doctors and doctors get £50. Oh, God, I've got years in the Times.
£55.
So I'm very conscious. I put myself in a category that really I might not need to be there. I just need to relax.
Well, I think you've done the right thing, so you're not just living with it. Susan's a psychologist herself and is very aware of anxiety and stress, and she very much, I felt, wanted me to diagnose that was the cause of the tremor. I just felt I couldn't minimise the symptoms as she wished me to. Okay, so let's do some coordination tests. It's one of the ones that we ask patients to do is just put your hands straight out in front of you. So
I'm very good at that.
Yeah. And now open your fingers. Yeah, close a bit.
I mentioned that
How do I get back to mine?
the car was stuck in.
I'll get on to tomorrow. So basically, here's how you take the
In M&S, and he said, yeah, he said there was one yesterday as well.
And then you do that with sync.
He's in 9, he's in a different room now.
No, we were in 9 yesterday.
We weren't in 12, wasn't yesterday.
Nice to see you. Come on in.
Likewise. Do you live anywhere near Kingston?
Do I live anywhere near Kingston? No. Why is that?
Oh, in 2 days, 2 people have jumped off the roof of M&S. In 2
Is that
different
right?
parts of the store, and our car is trapped there now until tomorrow.
Because you couldn't leave because someone.
Because they jumped off the car park.
Is that right?
Yes.
Gosh, that's
Well,
very
that's
sad, isn't
nice.
it? How are you doing?
I'm fine. I'm fine. The blood part of the urine disappeared after 1 tablet.
Did it?
Yes.
Okay.
I still took all 6.
Great. So no more bleeding in the urine?
No.
Any more clots?
No.
Nothing like that?
No.
You were going to see the urologist,
Yes.
is that right? Have
So
you seen the urologist?
Yes, so did you want to see us today to report
How
to
things
you
gone?
how it
Yeah.
all went? Certainly. They reckon they'll get something to you within 48 hours.
Okay.
But hot off the press, you can have it from us.
What did they say today?
I've got stage 1
Okay.
bladder cancer of an aggressive type.
So I've had blood in my urine since like May, let's call it, April, May.
As soon as my urine starts to go funky colours, I come in.
Brilliant. Thank you.
Is it normal for the urine sometimes to smell a little bit sort of putrid?
But that suggests infection, really.
Yeah.
Let me just dip this sample.
Yeah.
Oh. That wasn't very clever, but I've still got some.
When they biopsied all the crap they'd taken out, they found that the cells were would have been of an aggressive nature.
Right.
No evidence of it in the muscle wall.
Great.
And that's it, really. I'm very lucky, primarily because of you insisting on these constant samples and then taking it that bit further.
When you do pick up a cancer, it's very rewarding because it can have a big impact. It has a huge impact on people's lives, and most bladder cancers, thankfully, are picked up very early, before they've had a chance to spread into the lining of the bladder. And therefore, the prognosis for most bladder cancers, thankfully, is very good.
And how are you feeling about all of this? I mean, it's all kind of new stuff, isn't it?
Wonderful. It's whatever it takes.
Whatever it takes, yeah.
Whatever, and I don't feel at all bad. I feel absolutely wonderful that I've got it, because I know I've got it.
In fact, you know you can do something about it.
Yeah, right.
And nothing else is involved. And I
No.
think that's the important
She
bit.
did
of this.
mention the surgeon, who's a lovely lady, that bladder cancer rarely extends beyond the bladder.
This gentleman is an incredibly positive and determined gentleman. But in a consultation, I think I'm doing 2 things in my mind. One being present in the room and listening to what's being said, but also being curious about what I'm not hearing from someone who's dealing with cancer, and why I might not be hearing that. And that's as important for me.
Okay, good. So you're feeling positive about it?
I don't think I've ever felt particularly negative.
No.
You've not noticed, have you?
No.
Have you?
Well, a couple of times you've been a bit wobbly.
Well, when I made a reservation at Dignitas, I suppose you could call that slightly negative. But they said they didn't have any vacancies that Tuesday.
Will you do it when you stand in front of me? Put your fingers out, extend your arms and open your fingers a bit. And now could you close your eyes? Okay, I'm going to push the hands down and I want you to bring them back to the place that they're at. Now this time I want you to move between your nose and the tip of my finger as quick as you can. Good. Oh. Good. I want you to try and do that as quickly as you can. Quick, 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 quick. And the other side. That one's harder.
Much harder.
Yeah. Now try to do the walking and the balance, okay? So one of the simple ones is just toe heel, okay? Well done. Good effort. Okay, so if you could just write that underneath, that would be great. Thank you.
far slower than I used to write.
Really? Yeah. Yeah, and this arm was tremoring as well.
Oh, was it?
It was when your hand.
Can you tell more than that than the other things you've been looking at?
I think that did give me an indication of probably how difficult it is, being such a capable lady, to then have to work so hard at doing something like that. I was also slightly concerned about your toe walking.
Yeah.
That would make you quite at risk of falling as well as you get older. And it's fantastic that you're doing exercise, and we should really continue because that's going to help your balance. But
right.
You would be more vulnerable for falling as you got older.
I'm very conscious of walking now. I'm trying to keep a straight line.
Yeah. I think I should refer you to see a neurologist.
Right.
I can't diagnose anything just straight off.
Okay, neurologist here I come.
Neurologist, here you go. I'm so glad you've come.
Lovely.
Thank you.
I know, thank you.
You've been so candid.
I don't know how
and
you
open.
manage it, to give this amount of energy out to each patient. Just don't know how you do it.
Well,
I hope tomorrow's a rest day.
It makes it a more enjoyable job.
For some reason, I'm covered in a burning rash.
Right, well, you're a little bit of a mystery.
Yeah, I have a hot shower and it goes away.
It's weird, isn't it?
You lost 2.5 kilos in 4 days.
Yeah, that's a mystery.
I keep getting these blood blisters.
I mean, these are puzzling, I must say.
Sometimes in medicine we can't say what specifically something is, but I can tell you what it isn't.
What can I do for you?
I have a mobility issue in my right hand.
Okay.
I'm an office worker. Typing is becoming incredibly difficult, really quite painful. It's kind of something which has evolved over the last 6 months. Keeping it really simple, left hand.
Yeah.
That's it fine. Right hand is just have very limited mobility in it.
Okay. And what's the origin of that?
I don't know.
Okay.
I'm typically male, typically late about coming to doctors, all of those things.
Are you left or right-handed?
Left-handed for writing, but like right-handed for sport.
Okay.
The thing I'm wondering is I've learned golf this year. Don't know.
You have enough dexterity to do that, so to grip the club, but
I just noticed pain
typing.
Occasionally.
Do buttons up and stuff?
Doing my cuff is a lot harder.
Yeah.
But I can do it.
Have you noticed it with anything else? Tying your shoelaces?
No, shoelaces is fine.
Would you mind just tying your shoelaces for me? Or untying
It
them?
won't be a problem at all.
I'm just looking at you using that right hand, because that command, from your brain seemed to be automatic and seemed to work fine, didn't it? Do this again, so like you're playing the piano. Do you play the piano by any chance?
I used to a little bit when I was younger, but the left hand's 100%.
Yeah.
And I could do that all day long.
And you can't do that at all with that hand?
So I'm commanding my hand. It's very tiring. I'm going, come on hand, come on hand. It's mentally exhausting even just to do that.
Yeah.
I'm really saying, come on.
Yeah. So, for example, do this. So the elbow, shoulder, you can swing around.
I mean, I've got 2 kids. I can load up.
So
weight.
it's just the fingers, literally.
It feels
what
the
about,
fingers and the wrist.
So do your wrists for me. And round and round. Round with that one.
I'm trying.
So wrist and hand. If I touch your hands, does that feel the same?
Doesn't feel any. Without being extreme, doesn't feel like I've had a stroke or paralysis,
No.
anything like that at all.
And so the sensation to you feels the same. You're not no pins and needles, nothing like that.
No, never at all. I would have come. Absolutely would have.
And but you can't.
I can command it, but I just can't translate it.
I think it's quite common in general practice for a patient to come and to have something that it's very hard to put a name on and to diagnose as something. I think whilst medicine is partly scientific, there's also a lot of art to it as well, if you like, and it's some of what we do is almost trial and error.
What I am going to do is ask for advice. We've got a kind of email advice line. What we need to do is get some sort of imaging or study on that. We can do a nerve conduction, and I just want to check if that's the right thing to do or if it's some other sort of test. So what I'll do is I'll get some advice and then I'll let you know. So I basically I don't want to send you down the wrong route.
Yeah, no, it's a tough one.
But you've absolutely done right in coming to see us, and we need to look into it and find out what's going on.
Patients seem to appreciate it if you admit to your, lack of supreme knowledge almost and say, I actually don't know what's going on here. We're human at the end of the day, and we don't know everything, and as long as we're honest about that and admit that, I think they, on the whole, don't seem to have a problem with it, and I don't either, really, I don't think. I shall get back to you in either tomorrow or Monday.
Cool.
Is that all right?
That's lovely. Really appreciate your time.
Fabulous.
Thank
Okay.
you very much.
No,
Take
good
care.
to see you. All right. Bye.
Thank you.
Yeah, I was about to say. It's a good, strong handshake, so. All right. Bye.
I've got 40 tasks.
I've got none.
All right, rub it in, why don't you?
40 tasks. I haven't. I've got none from today.
I've got one. Good. One. It's because I don't delete them. That's how bad I am.
I actually asked the patient to come in for.
Come in.
Good afternoon.
Hello, hi. Is that Alexander? Is that right?
Yeah. Basically, about a week ago or so, completely out of the blue, in the middle of the night, I woke up to a really bad chest pain, right down the centre bone.
Right.
Nothing else really associated with it. No difficulty breathing. Nothing that was going to cause me concern or think I should rush into hospital. So I put some deep heat on it, and then since then the pain's just been fluctuating. I get a heartburny kind of sensation as well quite a lot of the time.
Is that before the pain came on?
During the pain,
During the
actually,
pain,
to be honest.
okay.
And so it comes in waves, and today and yesterday it's kind of become a little bit more consistent or continuous, I should say.
Right,
Because
sure.
it's making me feel a little bit groggy as well, to be honest.
Yeah, and what had you been doing that day or the day before? Can you remember?
Been going to the gym, and I have been going to the gym probably with more intensity or regularity than I would normally in the last couple of months. I've certainly stepped it up a bit.
Have you been feeling short of breath at any point at all?
It's not so much a shortness of breath as it feels like quite a laboured breathing.
Would it be okay if I had a look?
Yeah,
That's
absolutely,
okay.
of course it is, yeah.
And what do you do work-wise, if you don't mind me asking?
I'm an airline pilot.
An airline pilot?
Yes.
Oh, okay. And have you been on any long-haul flights or anything like that?
Yeah, I mean, I've been flying fair distances, but nothing outrageously far.
So in the last week, or?
Oh yeah, I've been flying.
Oh, okay.
I've been flying most of the week, in fairness.
Is it affecting work?
It's not affecting my work. It's just one of those things that it fluctuates, but it never affects my levels of concentration and what.
Fair enough. It's just the kind of niggly thing that's there and comes on and
goes,
lingers a bit. So if I push on it,
Yeah.
can you just tell me if it hurts you at all?
Yeah, that's tender.
That's tender. That
Yeah.
caught you. Sorry, I don't mean
It's
to
all right,
make you
that's
jump off the bed. What about on the other
actual
side?
Chest itself, no,
Yeah,
it's not
chest
too
wall
bad.
itself.
It's not too bad there.
I'll let you put your
Yeah,
shirt on. Do you mind just putting your t-shirt on, not the jumper? Just going to do your blood pressure, and then I'll go through what I think is going on. If it'll make a bit more sense.
Yeah, it's fine. I'll try and relax the arm.
Yeah, absolutely. Relax as much as you can. Okay. The upper value is ever so slightly on the higher side.
Okay.
It might be because I've been pushing on your chest and caused you a bit of pain.
Yeah, maybe,
just
I don't
now.
know.
Doesn't strike me as a heart problem in any way, because heart problems tends to feel a bit different, more of a kind of tightness, pressure sensation
Yeah,
that's
it's
worse when you're
certainly
doing
not that.
things. And I think you've got an inflammation of the bone here.
Okay.
But the fact that when you push on it, it's quite tender. It suggests there's something quite local around that area.
Okay.
I think this is almost certainly because of the gym work. The treatment for it is anti-inflammatory medications. So I don't know if you're okay.
Ibuprofens, maybe?
Yeah, exactly. Ibuprofen, okay.
No, thank you for your help.
And I think flying's okay.
Good. If you think it's okay.
No, I think it's okay.
Funnily
In
enough,
case there was
I've got
any doubt.
days off now, actually,
Fair
so I'm not in for a while. So I'll give it a rest now for a few days, and fingers crossed it'll work.
Hi there.
Is Dr. King on the third floor?
Yes, he is. He's on the third floor.
I was just about to get there. Is your name Brian?
Yeah.
Yeah, I'll sign you in.
Thank you.
What I've come in for today is, can you imagine, can you guess?
Stitches.
Take stitches out, yeah.
I think you might have a boil or an abscess there in your neck.
Let's take this one out and we'll see what happens.
That's hurting.
Sorry.
This piece of nail, it smells bad. Oh, yes, there's not much of a nail left. No.
Take some deep breaths.
All this is swollen, isn't it? The red thing around is still there.
I'm not sure what that is, and I was wondering if you can diagnose it.
I think it's a fungal infection from the way it is.
Right.
Hi.
Morning.
Is it Margaret?
Margaret Yekutiel.
Yekutiel, yeah. I'm Dr. Bavadia. Nice to meet you. Oh, is that just your...
Listen, I think I've got scabies. I get these frightful attacks of scratching. I mean, it began here and I managed to stop.
Yeah.
I get them on my hands. This was last week, there's the signs.
Right.
I'm also a doctor, epidemiologist. And it just looks to me like scabies. And I bought some stuff, actually. And then somebody told me there's a better stuff called ivermectin, which you can take as a pill. Can I show you a place on my...
Yeah, please do, please do.
Okay. I just want to show you where... Sorry.
Yeah, of course.
This was one about 3 or 4 days ago.
Yeah,
I scratched. I just couldn't think of anything else it could be. I've had it here.
Right.
There's not much old.
Is there anything else to see?
No.
No, okay. You've had an itchy rash that comes and goes.
Yes.
I've got no information on you. Are you normally fit and well?
Well, I've got cancer of the lung.
Right.
That's been done by stereotopic body radiation, SBRT, about half a year ago. And I had a myocardial infarction 7 years ago.
Okay.
My blood pressure's low, not high. Otherwise, I'm well.
Do you take any regular medication?
I've got some arthritis in my hip, so I take diacerin or something.
Doctors sometimes can be incredibly resilient and feel that because they have some, a lot of medical knowledge and experience, that they just deal with their symptoms. They might try and soldier on.
Where are you normally registered?
Israel.
Okay.
I'm here visiting my sister.
Okay, and you're an epidemiologist? What, like a doctor, like a public health?
Yes.
Okay, all right. And how are things in Israel, all right?
Ghastly. I may have picked it up in Israel. God knows, after this war, all the soldiers coming back. But I don't know. I mean, I didn't have anything there.
A difficult one. It doesn't look like classical scabies, but as you know, scabies is the thing that mimics many forms. I haven't heard of the tablet that you mentioned.
Well, I'll tell you how to spell it.
Ivermectin is not recommended.
Really?
Yeah.
Has it got contraindications?
It's on a named person basis only available and has been used in combination with topical treatments.
Uh-huh.
So I think perhaps you're better just using the permethrin.
Which is the antihistamine one?
Cetirizine.
Cetirizine.
All right.
The tablets.
Yeah.
That's for the whole body. You don't have an ointment instead. I mean, I don't need to take something when I've just got an itch on my hand.
It'd be better with that, probably.
Yeah?
Yeah.
I have in the past treated doctors who have felt that we should be doing one thing for them, and I felt that we should be going down another line.
It's like taking things more. I mean, I have to, but
yeah, try it. It's tolerated pretty well by people.
Okay.
All right. Take care. Bye now.
Why do doctors go to the doctor?
That's true. If you're a doctor and your friends are doctors, they could just prescribe anything for you.
Give you drugs.
Yeah.
Sorry, it's not ideal for you, is it? What can we do for you?
I'm going to see my family in South Africa next week.
Okay.
Which is quite traumatic as it is. Yeah. But I'm going to run out of pregabalin whilst I'm there, and I just wondered whether I could get some more pregabalin.
Is pain a significant problem then? Have we been sort of playing with things to try and get it manageable, or is it manageable at the moment?
It's not manageable because it's there all the time. So I guess we have in a sort of intensive period of trying to get this tilt assessed more. Yeah. And then also try to take me off some of my morphine because I'm quite heavily addicted to it.
Yeah. Okay. Perhaps not the time to start changing things now anyway, but I wonder have you flown before taking these medications with you?
Yeah.
sometimes people like a letter for those sorts of medications, which I'd be happy to, but you've never run into problems.
Yeah, I've got a prescription.
Yeah.
Thank you very much.
Anything else we can do for you?
Thank you.
Okay. Again for you. Cheerio.
How are you doing?
Yeah, the tablets are a lot better now. Thank God.
Great.
Are they?
Really, really well, yeah.
Mummy, come here.
And I'm actually waking up in the mornings feeling like I've had a sleep.
Great.
I'm so happy with it. I'm so happy, yeah, I feel a lot better. And
When
for the little
are
while.
you going?
I'm going to Ireland in 3 weeks, and then we're going the week after. So, yeah.
And where are you going to be staying?
My sister's.
No, in New York.
Oh, New York. Oh, sorry. We're actually staying in a hotel just off Central Park.
It's a beautiful time as well. to
It's
go.
lovely. I love it.
Yeah.
I love it.
Yeah.
And it's not.
Yeah.
I don't like going away.
Do you feel frightened to go
I'm a little bit nervous because I am worrying, is something going to happen to tumour up in the air, you know?
There is a risk flying. It's different for every patient and at every stage of the illness, and actually for where in the brain the tumour is. It's to do with the pressure of the oxygen in the cabin.
The thing about it is I could be here, I could be walking down the road and something had happened, so it's one of them things, you know what I mean?
Before you go, I think I'd quite like to give you a letter as well to take with you, give a medical history just in case.
Please God, but if anything happens.
Yeah, I think what was going through my mind through the consultation was I can't make Fidelma better. But I think it was just so important a trip for her to make. It was very symbolic. She'd been given this as a 50th birthday present at the beginning of the year when she was totally ignorant that there was a brain tumour growing. Oh, I'm so pleased you're going.
Yeah, no,
I'm
really
so
pleased. No, they've all been given out to me. My mum, she's gone.
Of course they
Go.
Of course they would.
Do you want to give Dr. Ham a high five?
Wow, that's stinging.
Come here, you've been
have a good time.
You've been so good to me, so you have. Really, really good.
Have a good time.
Yeah, I will. And you
Have a good time.
I'll see you. And
Yep.
if there's anything you want, let me know.
Yep.
I did tell you that.
You did tell me that. You did tell me that. Right, lovely to see you. Thank you. All right, bye. Bye. Oh, she's a nice lady.
My anus would get very sore. Every day I'd have to put Vaseline around the opening.
Is it a herbal thing?
Herbal, yeah.
What, to increase your libido or your erections?
Erection, yeah.
Okay, where did you get it from?
On the internet.
When self-harm, is that cutting?
I get really, really bummed out sometimes. Just everything's all doom and gloomy.
So you've lost 0.2 kilograms. So do you think it's a great success?
Yeah.
A great success?
Yes.
Honest?
Yes, doctor. I think so.
I've got months to live.
Is that what they've said?
No more treatment, they're giving up on me. And they say how much time I go.
Good morning, Putney Mead, how can I help?
Should I book you in for Wednesday the 5th?
When?
Wednesday the 5th of November?
For today? Don't have anything left for today, unfortunately.
Sorry, Wednesday the 5th.
I don't know how.
Wednesday.
It's with Dr. Diman. Yeah, it's a lady.
Mr. Libby.
Hello.
Hans, have a seat.
Yes. Oh.
Right, 6 months since I saw you last.
Was it? Is it 6
It
months?
is.
Yeah.
What's
Well-
the problem?
Well, it's various things. I've been since August feeling really tired. You know, I wake up exhausted and I keep getting, sweats and heart palpitations. But I think the most embarrassing thing has been I have had very loose bowel movement, not diarrhea in the last 3 months, but it's comes out like a little worms, and I never feel I'm getting rid of it all. And sometimes, very embarrassingly, I've messed up my pants, from farting and burping.
Your bowels have played up in the past, haven't they?
They've played up in the past, and this is slightly different in that before I used to get the runs and sweaty. Yes, my anus would get very sore. Every day I'd have to, I do have to clean it now, but it's not the soreness where I have to put Vaseline around the opening, before I go to bed. So, yes, there has been problems with my bowels.
Okay, Hans, just pull that up. Okay, so if you pop up on there.
Yeah.
So pull it up.
Yes.
And undo your waist.
Yeah.
And through your mouth, a deep breath. Right. Good. And this one. Good. Okay, fine. And relax.
You did examine me, through the rectum, and I think you said my kidneys were okay. You were feeling them.
Prostate, I think, probably.
Oh, was it the prostate?
Yeah. You're going to have long fingers to feel your kidneys that way.
Sometimes it's a bit overwhelming just to have to see people and act normal.
My muscles were twitching and stuff, but I think partly it's to do with the sort of stress or anxiety and it playing out.
Yeah, trying to plan your life is absolutely rubbish.
I'm still feeling like I'm in one of those teacup rides.
I try to ignore it and say that everything's going to be okay, but I do get scared.
But don't be too hard on yourself. You've come a long way.
Come in. Hello. Come in. Hi, have a seat. Excuse me. So,
Hi.
how are things?
Yeah, they're okay. They've been a bit bad recently, but
Bad in what way?
Just mood and stuff has been really low, and finding it hard to have motivation to do things, and also been binging quite a lot. So yeah.
Is there any reason why that you can think of?
I think it's probably because I wasn't on my pills. I don't know how long it was for, but I wasn't taking any for that period.
Was that, did you just run out or did you choose to stop?
I ran out and I couldn't afford it again.
Yeah, okay. And when you were on the fluoxetine, how were your symptoms then?
Sometimes there'd be like bad days anyway, but I think I certainly wouldn't get into anywhere near as black a mood. Like I get really, really bummed out sometimes. Just everything's all doom and gloomy.
It's very difficult when you're speaking to people about problems like this not to take some of it home with you. That's a very important aspect of general practice training, to ensure that that doesn't become too much of an issue in our lives. Alan Bennett said that you had to maintain a scrupulous and vigilant humanity. And in my work, that's something that I always try and remember and try and work towards. And in terms of the binging at the moment, what's going on with that? How much are you doing?
Well, I think it's happening on most days of the week. only about once or twice if it's a particularly bad day. But trying to get on top of that is a bit hard, though.
Yeah, it's really difficult. What about your menstrual cycle?
No word yet.
Really?
Yeah.
No, since when?
Since, I think, when I first came to you, like 2 years ago, yeah.
Understandable. What about laxative use or anything like that?
Yeah, I'm still using those. I know I shouldn't be, but...
Right, and how often do you use those?
Every day.
Do you? Okay.
Do you get constipated? Or?
Yes, both.
Yeah,
Both. I have both. Yes.
She's going to toilet perhaps 6-7 times in the morning and in the afternoon, and then again during the night.
Gosh. Still have a really bad stomach. Everything I kind of eat still.
It's coming straight through.
Yeah.
Is there any blood when you go?
Sometimes, yeah.
And is it loose?
It's more mucusy.
Okay.
Are you passing a lot of gas?
Okay. I can't go out unless I know where there's a loo.
Yeah.
You know, it just winds me up.
So, has there been any blood in your diarrhea? Or the looseness, really, that you described?
I did wander once, and I was with a friend. We were on a walk, and suddenly I had to. This was in the country, and luckily I had to take my trousers down, and I don't think it was blood, but it was a vermilion colour, the feces, and it was wet, and that's happened about 3 times where on country walks, I suppose. In fact, it happened last Saturday, where I had to go and quickly hide in this woodland whilst luckily, now what I do, I have toilet paper with me to...
Very sensible. Okay, your blood pressure is okay.
Oh, that's good.
I think we need to start off with making sure there aren't any abnormalities on a raft of blood tests. And I want you to come back and see me in 2 weeks' time.
2 weeks, yes. Yeah, I'm sorry to have all these symptoms.
Well, there's certainly a fair bit to get to the bottom of.
That's a bit of a pun, isn't it?
Could be.
Yeah.
But I'll see you in 2 weeks' time.
Okay, thank you, Dr.
Very good.
Mackenzie.
What's going on in life at the moment? You're still studying, is that right?
Yeah, just doing my dissertation, and then I'm still at work part-time as well.
Okay. And how are those things going?
Yeah, they're okay. Sometimes struggling to go into university a bit. Yeah, that was like 2 weeks where I just didn't go in, which is bad because I've only just started the year, but...
Okay, and what do you do when you like that?
I stay in bed all day, and sometimes I self-harm a bit, but yeah.
Yeah. When you self-harm, is that cutting? And any thoughts of trying to do more than that?
Thoughts, but I don't think I'd act on them.
So in terms of today, was it to restart your medication? Or?
I think that would be good.
Yeah, it sounds like it'd be a useful thing for you. Finally, I think we got a letter from the Eating Disorders Service that said that you've been referred for an assessment for your suitability for something called dialectical behavioural therapy. So you're seeing them tomorrow?
Yes.
Yeah. Can we have a chat in about 2 weeks' time?
Okay.
We'll have a chat about what it is they're offering and sort of what support you've got, and we can then decide to go from there. Okay.
Good morning, Putney Mead. Rachel speaking.
Say ah.
Just look up for me.
Ah.
No. Can't really get to see your tonsils.
I mean, I took a phlegm sample. There's a bit of blood in it as well.
Yeah, I don't think I need that sample somehow.
Hi, Onda. Come in. How are you? Sorry to keep you waiting.
You were almost late.
I know. I'm so sorry. Come and have a seat.
I haven't got better now, so I've been really ill.
Because you saw Dr. Andrews, didn't she, because of your chest?
My chest has been unbearable.
Because you were on some antibiotics initially, were you, or not?
Well, they prescribed them.
Yeah.
And I didn't take them because I thought I don't want to mix the antibiotics and the pump. Because I was taking the pump as well because my chest was really bad.
And have you had any temperatures?
I was getting hot. I thought, do you know what I mean? So a lot's been happening.
Sounds like it. Let's pop this in here. Okay, so your temperature's all right.
Yeah.
You take your jacket off and we'll have a good listen.
I still got a bit of the cough, but not. Because I'm going away on Sunday.
Are you going to Blackpool?
It's Sunday, because it's my birthday on Sunday.
Oh, lovely.
So
you want to get well for that?
Yeah, so I don't want to be ill. That's what it's, do you know what I mean?
Do you want to lift your shirt up so I can have a good listen? Big breath. And just sit forwards. Again. Chest sounds all right, actually. I can't hear any wheezes today.
I'll check my weight while I'm here.
Yeah, no, of course.
I think I've got on my... Everything's gone pear-shaped at the moment.
On you go. Well, only ½ kilo, so it's not terrible.
Well,
yeah, we do want it to go the other way, but...
But to tell you the truth, Dr. Wallace, I'm trying to do it myself before going to Slimming World.
I think you should go to Slimming World. What's putting you off?
I've lost the form.
You've lost the form?
Yeah.
Do you need another one from Laura?
Not being... I haven't done it deliberately.
No, it's fine. I'll speak to Laura and I'll get her to sort out another one for you, because I think it is important to have the kind of support of Slimming World.
Also, I've cut down on my drinking.
Good, because that's empty calories.
But I haven't drunk for 2 weeks.
Good.
But I'm going to have a little drink next week. That's... Because I'm away, so you do, don't you?
No, definitely. It's got to be a combination of diet and exercise.
I mean, my diet is quite good, really.
Good morning. Sorry, I don't know where I'm going in the afternoon.
I've got some pecans, a valuable source of protein and amino acids.
You can.
Oh, God, I've got a bit of old cake in there. Jesus. There we go. Come and have a seat. What are we doing?
Strange comment. One is, I feel like something's growing inside me, but I just wondered your comments. But the other thing is, I notice in the mornings my skin's tingly.
So tell me about this thing growing inside you.
Oh no, it's probably just I'm just overeating. But it just.
Do you think
feels
you've put on weight?
Yeah, I've got a massive gut, which I didn't used to have.
And how much weight do you think you've put on?
Oh, I know. I weigh 14 stone,
Okay.
but I haven't been exercising for a year.
Why's that?
Lots of things happened in business, and I didn't have the stomach for it. Pardon me. Yeah.
Your eyes look a bit sore.
Oh no, that's out for a birthday dinner last night.
Oh, sorry.
Yeah.
So how much are you drinking, do you think?
Oh, at least a bottle a day of wine.
So more than you did?
I don't know what I said last time. We all lie, don't we?
I don't know. You know whether you lie or not.
Well, it's about the same, really. Yeah.
So you drink at lunchtime?
Yeah, I like lunches. So lunchtime and always in the evening, anyway.
Yeah.
Yeah.
Should we feel your tummy? I think that we need to do that. So slip your thing off. So maybe we should just do a whole load of blood scan and just check on everything.
That's fine. Just sit down.
Yeah, just lie down.
Lie down. Okay.
Come in. Hi there, hi. Have a seat. Yeah, good, good. How are you?
Yeah, so I actually wanted to see if I could get some amphetamines because being from the US and I did have a scanned copy of my prescription.
Right.
And the doctor had posted my prescription online, so would that be sufficient enough?
I wouldn't necessarily be happy to prescribe sort of amphetamines just based on the prescription from the US. Would you just explain a little bit more about what the prescription is for? And
it's my ADD as well as I'm a I've been having difficulty concentrating and going for a master's right now, and I guess I've been doing without them, and it's not good.
Right, okay.
Yeah.
In the UK, it's not often that we get people requesting drugs like amphetamines, but I think in America it's much more readily available, so people can be prescribed medication like amphetamines for exams because they're labelled sort of smart drugs. But within the UK, those have been restricted in terms of prescription. Do you feel that at the moment you need to use other sort of drugs or alcohol at all to help manage the stress, or?
I did smoke a spliff once, but that did help, but that's not advised.
And how does that affect you mentally?
Makes me focus.
Right.
Yeah, I can get work
It
done.
helps, does it?
It does.
You sure?
Positive.
Right. And, I mean, do you feel depressed or... Right. It sounds like there's a couple of things, and I'm just wondering what the best way you think of us helping you with that.
I don't know, it's hard to say. I mean, if I could really get those amphetamines, I mean, I almost... I almost cried myself to sleep last night.
In the UK, in terms of prescription of that type of medication for ADHD or ADD, then it's usually specialist prescribed, certainly initially. So what we'd want you to do is see a specialist and for them to confirm that that would be helpful for you. In the meantime, I mean, the other things that we can offer would be some help, some psychological support, help with stress management and that sort of thing. I mean, is that something that you've had before that you'd be interested in?
To be honest, like, I'm just, I don't know. I guess, like, if I did get, like, a pamphlet or something in regards to it, I'd think about it.
Okay. Often problems are very complex and there are a number of different things that we as doctors can help with, but ultimately the patient is responsible for what they then do with that advice. That can be quite challenging as a doctor to change that mindset, to enable patients to take some responsibility for helping themselves.
Okay, what's the problem today?
All right, I took the medicine for losing weight, and it's finished.
Okay, if you take your jacket off, we better see if there's any evidence that...
Yeah, I hope so.
Okay, where you go. On your pop. Okay, 123.8. Right, so the last weight we did on you was 5 months ago, and you were 124. So you've lost 0.2 kilograms. So do you think it's a great success?
Yeah.
A great success?
Yes.
Honest?
Yes, doctor.
Right.
I think so.
Okay, well, let me...
a bit lighter, anyway.
So with Orlistat, there are some fairly strict guidelines for us to prescribe it.
Okay.
So continue treatment beyond 3 months only if weight loss since the start of treatment exceeds 5%.
Yeah.
I'm trying to lose weight and it's just not really working.
Okay. I'm going to just wait until it goes 0, 0. There we go.
Okay. So how much weight do you think you've put on?
I'd probably say a stone.
Yeah.
So you've put on 2 pounds.
Oh dear.
Okay.
The body mass index doesn't come up very well with me.
Yeah,
Because basically doesn't take into account my build.
You probably haven't pushed yourself as much with regards to the exercise.
To be honest, when I get out of work, the last thing I want to do is go work out.
I leave the house at 7, and by the time you come back...
The motivation is...
Yeah, I know.
I want to go yoga.
Oh, yes.
Which is very good.
Yes, very good.
The trouble is, I don't know, I shouldn't say, but it's so grim.
What we're trying to manage with it is preventing things from happening in the future, like heart attacks and strokes.
We're not all sporty. But actually having a think, what you might enjoy from an exercise point of view is worth it.
And you were referred to the dietitian.
Yeah.
Is that happening? Still?
Yeah.
Changes?
Yeah, I changed my diet. But because of my knee, I can't do much exercise. The physio told me I should stop.
Yeah, but obviously your knee was stopping exercise, but the Orlistat was stopped because you'd not been meeting the weight loss target. You know, their role is to help you with your diet and weight loss and exercise and performance. If they think that they're not succeeding and that we need to do something else, they might recommend to us that we prescribe something like Orlistat. The reality, though, is that having had it, it's not really achieved the targets that the NHS dictate to me as a justification for carrying on that prescription. Okay?
All right, can I have a painkiller?
You can have a painkiller.
So was it a good party last night?
Yeah, it was. Yeah.
Okay, up you get. Put your things on. Let's just check on stuff, and then we can see you back with the results. Tummy feels fine. Right. I can't feel anything there that's
just slack.
A bit of slack. I mean, if you can manage to get back to your exercise regime, you're going to feel so much better, because you always do, don't you? Take that, and then you book an appointment for a blood test with the healthcare assistants.
Fantastic.
And we'll see you afterwards.
Thank you very much.
Okay.
Have a good weekend.
Yes, I hope so, and you. Not too good.
I've got this kind of freckle thing here, which I don't think I had when I was little.
Has it changed at all?
No, it just gets a bit more crispier, because I just picked a bit off.
You don't pick and squeeze things.
Squeeze it all the time. I've got a spot on the end of my nose. And I look at it every morning.
Last Monday, my hand started peeling and all the skin came off.
Pretty classic for something called seborrheic dermatitis, which is triggered by yeasts.
Yes, it feels very much like eczema.
Yes, I get it on my face, on my torso, my legs.
Okay.
How can I help today? My psoriasis has suddenly flared up. Over the weekend on my hands and my feet.
Do you mean psoriasis or do you mean eczema?
Well, I was told it was psoriasis last year, but I don't know whether it is or not.
It certainly looks like eczema to me.
Oh, right.
And we haven't got you coded as having psoriasis, but I can check.
With a P, psoriasis.
Yeah, it's a silent one. That's why we call it psoriasis. So tell me about when this came on.
Well, it literally came out like late Friday night, Saturday morning.
Okay.
And it's the same on my feet. You can see where all the little blisters are starting to pop.
It's quite interesting how your skin blisters.
And then they all pop. I mean, all of my feet, it all pops open, and then.
What do you normally put on it?
Well, I've been using Chinese herbs on it, which I bought with me. Okay. Because I find steroid cream makes it flare up, and then all the skin splits.
Okay. So Chinese cream often is made of steroids.
Oh, is it?
Yeah.
Because I find this doesn't work. Those are pills, and then they gave me this. Problem is, it's written in Chinese.
So I mean, I have no idea how safe this is or anything, but there is a lot of people that say that one of the reasons why Chinese medicine is so effective is it's got a whacking dose of steroids.
Oh, really?
Yeah.
I didn't know that.
But not monitored.
Of course,
and so
sure.
not safe from that point of view.
And it would be in the pills as well?
It could be.
Okay.
So I can't recommend them, obviously just because we don't know what that's in.
No.
There have been case reports of these medications containing dangerous levels of mercury, arsenic and lead. There was a big case last year, showed that they even contain parts of endangered animals. And although they're sold as being natural, that doesn't necessarily mean that they're safe.
Now, your liver function isn't entirely normal. Are you on any medications at all?
No.
Anything herbal or anything over the counter? Any supplements or anything that you're taking?
Yes, I did take, yeah.
What's that?
That's the it's a natural stuff for it's that sexual thing.
Okay, so it's a herbal thing?
Herbal, yeah.
What, to increase your libido or your erections?
Erection, yeah.
Okay, and where did you get it from?
On the internet.
Okay, I would stop that, because do you actually know what's in it?
No.
Let's stop it just in case, because some funny herbal stuff can make your liver test go off.
Okay.
Some medication that's being sold as alternative or natural contains the same ingredients as pharmaceutical medicines. So one example is a herbal remedy that you can take for erectile dysfunction, which was found to contain sildenafil or Viagra, which is a medication that has lots of side effects and can be dangerous if it's not prescribed under the right conditions.
I actually tried one of those Chinese places along the road, and I'm not sure if that made it worse.
What kinds of things did they try?
She was thumping it.
Right. Okay.
And then asking me to like chanting, all that kind of stuff, like fake. I don't think it was.
So probably at the moment I'm not sure if chanting's going to sort out your neck.
Good morning, Putney Mead. Naomi speaking. Hello? This is Putney Mead. How can I help? Putney Mead.
So how are we today?
Pardon?
How are you today?
Yes, how can I help? How can I help?
Well, that's not... Thank you very much. I am not bad.
Not bad, okay.
Dr. Smith? Dr. Smith?
Oh.
That's sore?
Yeah, very sore.
She won't be able to phone you because she's in a clinic. She's in clinic today.
There's a little bit of normal wax in there, but nothing that's causing deafness.
All right, take care. Bye-bye. 100 years old. That's crazy.
Hello there. Come through. Sorry to keep you waiting so long. Come in. Come and have a seat. So how are things with you?
Not so good.
No?
This day, I'm so-and-so, other day, down with the weather.
Yeah.
And I go months to live.
Is that what they've said?
They say, anything they do make it worse. Now it's come out from the lung, it's my organ. So no more treatment, they're giving up on me. Okay. I'm planning to go in Italy Thursday.
Are you going back to Italy to sort things out, or what's going on there?
Well, I've got a nice flat there.
Okay.
And then give something to the friends, cancel all the banking and all sort of thing, Now, do you think I need something on the plane? Because the plane is pressurized. And with my breathing.
Yes, that's what I wonder. Let's check your oxygen levels.
Okay. The arthritis attacked me in my shoulder, my neck.
Just relax your hand down. There we go.
I'm disintegrate.
But you're still smiling.
Yeah, no, I keep smiling. People say nothing wrong with you.
Oh.
Oh, my favourite. I'm very fond of raspberry jam.
We know on the X-ray there's a little bit of wear and tear in your spine.
About 3 weeks now, I've had pain all down my leg, and I was worried maybe it was my hip.
Obviously, I overdid it because I think I'm 20 and I'm not.
I'm afraid that's fairly consistent with being 83 years of age.
It's no fun getting old.
Yeah, I know. People say.
Did you ever have TB when you were younger?
No.
Never. And just remind me, you were a smoker for quite a while.
Yeah, and not only that, the job I'd done, but that's the coaling and...
What job did you do?
As a coalman.
Right.
Okay. You're too young to remember.
No, I am, but I know what they were.
Coal on your back, I mean, I'd done that for 25 years. I carried thousands of tons of coal.
Yeah.
But there again, that's the job you had to do, wasn't it? You either did them or somebody had to do them anyway.
I think what you're going through is related to all that.
I do honestly. I can't think of anything else really.
No. Do you bring up much phlegm?
Yeah, it's all clear. It is clear though, but it catches in the night, and I've got such a dry mouth.
Really?
It's dry, absolutely dry. I have to drop of water, like a bottle of water. I don't have a glass of water.
Right.
Don't ever have a glass of water in your bedroom. I'll tell you why, because I always went with a glass of water in a bedroom, and I never turned the light on. I just picked it up and had a sip. And one night I just turned it on, and there was a nice big spider having his early morning dips going round in it. Oh, God. I'll never again. But anyway, I digest as usual.
I can't do it. It's quite hard. I mean, my granddad's Scottish. My granddad is Scotland. There's a wee chance of that. Someone classed me as Japanese once.
What?
I know. I went,
are you serious?
She was like, you got that Oriental look about you. I was like, no.
So deep breaths. Good. Let's have a listen at the front now. Good. That's fine. Has anyone ever talked to you about what we would call what's called a chronic lung disease? Has anyone ever talked to you about lung problems that you might have had that have been there for quite a while?
Well, I've always known I've had a bit of
that scarring.
Bit of a chest, like, you know.
Okay. What I was thinking when I saw you last time and what they saw signs of on the X-ray is something that we call COPD. Basically, as I say, it's long-standing damage to the lungs.
I can imagine that.
Yeah. What we need to do is do another investigation into it, which is a blowing test to give us a firmer idea. But no, if it's what it all points to.
Yeah.
It's not something that we can cure,
no.
But that doesn't mean we can't improve it. So, the test I want you to do is something called spirometry.
Oh, yeah.
Once you've had this done, what we'll do is start you on some regular inhalers, which I think will help a lot.
I feel better already.
Big breath and then breathe out as hard and as fast as you can. That's it. But short and sharp, not quite so long. So really try and... But better. Do it stronger than that. Really try and blow the end off. I think that's best you got, wasn't it? OK, you ever sit down.
Okay.
Let's have a little look at your things here.
I tucked myself in.
OK. Do you want a hand? Are you OK? Do you take any regular inhalers or not?
No, not regular.
I wonder whether it might help, because I mean, there's a little bit of a wheeze there, but should we give it a go?
Yeah.
What I want to do as well is talk to the chest clinic, who know you very well, and just get their advice about how safe it is for you to fly, the risk of the cabin pressures and things like that, and whether, if they think it is safe for you to fly, whether you need to have oxygen on the flight. I mean, obviously, having lung cancer, it is going to make flying dangerous, because we know you've got a lesion in one of the big airways, and the risk is that could obstruct and make your breathing substantially worse. The other thing is, when you've got cancers, it does increase the risk of you having blood clots in the legs and the lungs. So I would recommend getting some flight socks for when you go on to the flight. Don't drink any alcohol, and just try and keep your no alcohol, because that dehydrates you and it increases the risk of you having blood clots.
I got to go there. Maybe because they say the hospital go as soon as possible.
And I mean, obviously you've been told that there's nothing more they can do at the hospital. Have you had any thoughts about what you want to happen or what you don't want to happen as things continue?
Been talking about the heart stopping. You want the revival? Say no. Let me go. Yeah. What's the point? And I hope I'm going to have a nice birthday down there. I'll be 77.
Will you be over there still, or will you be back here?
Of course, I've got to be back here.
You'll be back here by then?
Yeah.
Okay.
If you're still breathing.
Oh.
That's it. And this is now fetal heart.
She's got an ear infection and lots of stuff is coming out.
You haven't done anything wrong, but I think that's just got infected.
Ugh. He doesn't want it.
No, he doesn't, does he?
Hold still, sweetie. Hold still.
That's a good grip that you've got.
Just trying to stimulate his gag reflex. It's not nice.
No.
So mean.
Sorry.
She's so mean. Well done. Over.
I'm Dr. Mackenzie. We spoke a few months ago.
Yeah. Now, when I last came in, I was pregnant, but unfortunately I had a miscarriage. No, that's okay. But I'm pregnant again, which is great. But obviously I'm really, really nervous. Every time I go to the toilet, I wipe and I'm scared I'm going to see blood. I'm just on tenterhooks all the time. And I was just wondering if I could book an early scan, if that's at all possible.
There's certainly not much point in having it done at 7 or before 7 weeks,
Yeah.
because it can sometimes be inconclusive,
Yeah.
surprisingly.
Yeah.
So you don't want any negative information. You want
Yeah.
to either know that things are fine or not fine.
Yeah. And do the risks of miscarriage decrease quite significantly after 8 weeks? when you're safe?
Statistically, probably a fifth of all pregnancies are lost as early miscarriages. So about 1 in 5.
Okay.
So having had one miscarriage is, I'm afraid, not uncommon. So cross fingers, not going to happen again this time.
Yeah.
But even if it did, the advice would remain, well, okay, let's wait for a normal period.
Mm-hmm.
And then you try again.
Again, yeah.
If this one happens the same as last time, well then, as I say, it's sad and upsetting,
Yeah.
but it's not the end of the road.
Yes. Yeah.
To try again is
If I had one miscarriage, is it more likely I'll have another one, or is it completely...
completely independent.
Yeah, yeah, okay.
Oh, gone. Can't be that bad.
Come in. Hi, have
How
a
are
seat.
you?
What can I do for you today?
I've just found out that I'm pregnant, and I wanted to check in with the practice and
Okay, yeah.
go through whatever we need to go through.
Okay, is that good news?
Yeah, good news, good news, good news.
Congratulations.
Thank you very much. No, quite sudden. I hadn't come off the pill for very long, so I can't believe I'm pregnant this fast.
Okay. And was it something you were trying for?
Yeah. I came off the pill deliberately, so yeah.
You taking folic acid?
No.
No.
Okay.
I'd suggest taking folic acid and vitamin D.
Okay. The other thing that I have on my mind is that I was training for a marathon, and that's due on Sunday. I'm concerned of running a distance like that in such early pregnancy would have I don't know.
Okay. I think because the risk of dehydration and things is quite high anyway.
Mm-hmm.
I know you're not far on.
Yeah.
I just wonder to be on the safe side, I'd say no. Is that all right? Sorry about that.
No, it's fine. I kind of was getting there myself, but it's...
Yeah. Okay.
Yeah, that's
I'm
fine.
sorry about that, though.
No, that's fine,
Because
that's
you'll
fine.
have worked very hard.
I did. I spent the last 6 months training. Look, this in itself is...
Are you desperate to do it?
I was. What's more important to you, your health, your baby's health, or running a marathon in the grand scheme of things? You're gonna,
in the grand scheme of
you'll
things,
get
you can
over the
always
marathon.
enter next time.
Yeah, exactly.
Yeah.
Yeah.
So how are you anyway?
I'm okay.
Okay. So last time I saw you, we checked your blood pressure and it was a little bit high, and then you very kindly went on to do some blood tests, didn't you? Okay. You look
Sorry, Beth.
nervous.
I'm so sorry.
Why?
I try to overcome it without anyone knowing that I am very nervous, you know.
What are you nervous about?
I don't know really.
We're just feeling a bit anxious.
Yes, I am. And I know it's partly me, and I'm trying to sort of... Thank you for listening to me.
That's all right. That's what we're here for.
Thank you very much.
And we talked last time about your late husband as well, didn't we?
Yes. It's a lot of sorrow within me at the minute, you know. Although it's 4 years ago, and we had a wonderful time and everything. You know, I think he was told he had 6 months to live, you see, and it was devastating because we didn't realise that he'd got anything, you know, so dramatically wrong. He had pancreatic cancer.
Right. Okay.
And we were both kind of numb. The sadness of losing a second husband. The first husband, he went to work and died. I didn't get to him. I walked into the room and I said, I'm so glad I've arrived in time. No. Massive heart attack in King College Hospital, and that was shutting everything off, dealing with the children, you know, the heartbreak and not being able to cry at all, really. No tears. I'm talking now because I probably need to feel that I can have a little bit of help here from and overcome it.
It's obvious it still plays on your mind, and it can be therapeutic talking to somebody.
Yes.
I mean, what do you think about having some counselling? Because we've got great counsellors here, and they could talk to you about your loss. I think it would be really helpful.
Yes. You know, the sadness and the overwhelming sadness. I'm going to cry in a minute.
Oh.
Sorry. No.
You can.
Sorry.
I think as a GP, we do have a very privileged position in that we learn a lot about patients that probably even their closest family members and friends don't really know, because it's often easier to tell somebody totally removed from the situation about what's going on. And to see what some people have to deal with in their lives is quite incredible at times. And if I can actually be a part of helping them through those difficult situations and see them on the other side, then it's incredibly rewarding. This is for you to fill in before you go and give it to the girl on the desk. It's about the counselling, OK?
Yes, thank you so much. I really appreciate it.
No problem.
How do I appreciate everything? You're very kind.
All right.
I don't know how to thank you.
Oh, anytime. See you later.
Bye.
Cool, thank you very much. Have a nice evening.
And you.
All right. Thanks a lot. You're welcome.
Bye-bye. Oh, thank God. Oh, finished.
Hello, Putney. How can I help?
Everybody drinks. Everybody goes to pubs, and you don't tell them that, do you?
I do. I tell everybody.
I am not a moron, and I don't like being treated like I've got half a brain. I haven't got half a brain. I've got a whole brain, and it functions beautifully.
There, that's where your penis is. That's where you breathe from, and that's where Dr. Owen's showing you.
Exactly.
Oh dear.
This is just this morning.
I've got liver cancer, not brain cancer. You know, I can still function, and I want to do that. Every day's precious.
Good morning, Putney Mead, Iris speaking.
Yeah. I'm just trying to see who else does it.
And your name?
Who else does that thing for you? I'm trying to see which other doctor does it.
Hello. Sorry, I've kept you waiting too long.
It's all right.
How are things?
It's peculiar what happened. I was stung on my arm by a wasp that came in through the window.
OK. So when was this?
It was a couple of days ago. I couldn't move my arm. It swelled up, and then it felt achy all the time. It's still funny, my arm. I don't know whether it's because I'm a funny woman.
Do you want to show me where the wasp stung you? Done a hand. There we go. You got that one?
It sort of swelled up there, and it still prickles or something and aches.
Well, nothing's hot or red or angry.
It aches still.
Now, what's happening with the psoriasis? Have you been going to see the dermatology nurses?
I haven't, because I've been too busy.
Because they were supposed to see you, weren't they, in the daycare so that they could do your creams for you. It's still quite bad on your elbows, isn't it?
It will go. It doesn't hurt.
What's stopping you from going to see the nurses?
It's because I'm tired. I get tired. I can't sleep at night. I lie awake. We're moving.
Yeah.
And it's awful.
What's happening with your sister?
She's going to the country.
OK.
Retirement home.
And have you found anywhere that you're going to live?
No, I can't find anywhere.
As GPs, we're always taught that we should ask open questions and let patients tell their story, but it can be really difficult when patients bombard you with lots of different pieces of information at once. In a 10-minute consultation, that's really difficult. So are you wanting to buy something then?
I want to buy a flat for the rest of my life. I'll be on my own with my cat, that's all. My sister doesn't want me anymore.
Oh. So, did you ever think about going with her, or do you want to stay in Putney?
I want to be near Morley College, where I give concerts and I play Beethoven, Chopin, Brahms, Rachmaninoff. And I played all my life since I was 5 years old.
OK.
Music keeps you young. It kept me young. My father died of a heart attack in the hospital. I just visited him and he said, good luck for your concert. And it was sad, really.
No, it is.
He said, be happy when you play. And he smiled. That's all.
I'm falling apart, basically.
Right. Oh dear, OK.
The last 4 or 5 days, I think I had an ear infection. My ear was agony.
Right.
And also, I would like you to look up to see what progress they're making towards this hernia.
Right.
And the large cyst I found, and I've had enough.
Yeah.
Do you mind if I have a good look at all the joints on each side?
No, have a look at everything.
Pain when I'm pushing?
Yeah.
Up and down, does that cause pain? OK.
Yeah.
Bet they fractured a bone in my groin.
When?
When they done the angiogram.
OK. All right. Where do we start?
You have to go in soon.
What?
You know, the doctor's going to look at your ear.
Okay.
You can be a good boy and let him look.
Okay.
You can be a good boy.
Yeah.
Hello.
Hello.
Yeah.
How are you?
I'm well, thank you.
Come, Mommy.
Hello, Matthew.
Hi.
When did I see you last? That was a while ago.
Hey.
Not
It is a
quite
while
like
ago.
10. More like 10.
Yeah, 12 now already. He has got another ear infection, and I only noticed it yesterday evening when we were in church that he had a lot of gunk coming out of his ear. He won't let me touch it.
Right.
He insists that it doesn't hurt, but he quite often does that. I've never been able to be sure whether he's just got a very high pain threshold or whether his communication's a bit off around it.
Cough, cold, snuffly nose.
He's been very tired, but no, not really. No. And it's quite difficult with Matthew because he doesn't tend to develop particularly high temperatures.
No.
And quite often, you know, it's only when you see the evidence of something. I imagine this has probably been quite uncomfortable for him for some time, but it's only seems to be when there's some visible sign.
Can I just have a little look at your ear?
Yeah.
It's a bit of a mess, isn't it? You can't see it, though, can you?
He won't let me clean it or anything.
Can I just touch it with a stick?
Hi.
Yeah, not going to go inside, just on the outside. Get a little bit of that fluid. You look at Mummy for me.
Matthew, look at me.
That's good boy.
Look at me.
Ow, ow, ow.
Good boy, good boy, good boy, good boy, good boy, good boy, good boy. Ah, good boy.
Well done. Good boy, Matthew.
I like your jacket, Teresa.
Oh, do you? Well, you're not having it. I'm not joking. I've seen you for a while.
No, we haven't. Have you been well this early?
Yeah, but did you go to get fun
So
one up?
yesterday, I read this, and it really frightened me when I read it.
Oh, really? Okay, well, we can talk about that. With this, what scared you about it?
It scared you about people dying, you know, not surviving the operation and that.
Yeah. Okay. Did you understand what it's talking about, this
Yeah.
aortic aneurysm? Yeah. What did you understand by it?
Well, because my father had one.
Did he?
Mm.
You said your dad had a problem with one, did he?
Yeah, because he had the operation, and 2 weeks after he died.
Did he?
Because he had a blood clot. Do you know if I've got one?
Hi. Oh my goodness. You have got a really big buggy, haven't you? Yeah.
Does the airway sound quite tight? Oh dear. Life is hard, isn't it?
All right, okay. All right, dude. Okay, cool. Oh.
Can I just pop this in your ear and take your temperature?
Can you hold your hand quickly?
Just, whoopsie.
Oh dear.
It's all right.
Poor old you.
Come on, Bubba, please.
You got your hands full, haven't you? Do you want to just give him a cuddle and then I'll just have a look at it?
Oh, come on. Come on, Bubba. Come on, sweetie.
Right, how can I help today?
So we just need to get a certificate of health from his modelling agency.
Let's have a look. She's going to be a superstar, is he? It's nice to see a well baby. I see lots of time seeing grizzly babies. Now, we'll have to ask at the desk whether or not sometimes these things don't technically come under NHS services and sometimes there's a fee.
Oh, yeah.
But I'll ask. Can I have a look at your tummy? Lovely. We'll just give you a little once over. Oh, let's have a little listen to your heart. Good boy. Look in your mouth. Good boy. Thank you.
Very good.
Magic. So what I'll do is, I've got no reason to be concerned at all. I will sign this and I will just put it in an envelope and ask you to speak to Nicola, who's currently on reception.
Okay.
Good luck with his stellar career.
Are you still smoking?
I still smoke consular, cool as a mountain stream.
How many a day?
About 10.
Okay. Any thoughts about quitting?
What?
Do you want to stop?
Watch what?
Do you want to stop smoking?
Not particularly at the moment, I'm worried.
I mean, it may not be the right time for you to stop smoking now, but I think it would be important to do it when things are more settled. What about alcohol? Because alcohol can increase your risk of osteoporosis.
I'm trying to cut down.
That would be really important if you try and cut it down so that you're having less than 14
My sister, we
units.
both try and have half a bottle each.
Over what period of time?
On a night.
Half a bottle a night?
We have little small glasses. We fill, and she goes back again and fills.
But if you're having half a bottle every night, that's much more
No,
than...
she has her bottle. I have mine. They are small ones.
OK, but even if you're having... What, do you have the whole bottle?
No, we don't drink... No, we have she has a small glass and she fills it about that full.
Right.
Full.
What we recommend is that you don't have more than a bottle, if you're drinking wine, a bottle and a half a week.
Oh, everybody drinks. Everybody goes to pubs and you don't tell them that, do you?
I do. I tell everybody that they need to not drink more than the recommended amount. The other thing that you need to do is make sure that you're getting enough vitamin D and calcium in your diet.
Oh, I expect you're hungry, aren't you? Have you had your lunch?
I haven't, no, I've been busy.
Oh. Well, you must come to my flat when I buy a modern flat in Putney and have a meal. I'll cook for you.
Thank you.
Spicy cheese grilled.
Okay.
And you put tomato puree, a bit of that, and you make an ordinary tasty thing, and you put few herbs in it, and then you grill it, the top of it.
Sounds good.
And put a gherkin on top.
Okay. Right. The things that I'm going to do is, why don't we see each other in a few weeks, okay? And then you go and see the dermatologist tomorrow about the skin, okay?
Yeah. I better go.
All right.
Thank you very much.
And that's your time of the appointment, remember? So you take that. All right, so you go and see them tomorrow.
Thank you.
See you later.
What do doctors do when they finish at 12 but then start again at 5?
They either go home if they live close, or they do paperwork, like catch-up work.
This is Dr. Hassas from Putney Mead Surgery. Hi there, I had a message to give you a call, sir.
The work is endless. And I was expecting to see you this morning, I think, to check your blood pressure. When we've finished seeing our patients, we've then got to type our own referrals, read all the letters coming back from the hospital. We need to check blood results, review people's repeat medications. The list is just goes on and on and on, and you never feel like you get to the end of your work.
Well, when did all the trouble start?
I tried to ring you yesterday, but you were unwell.
Just give me an idea how long this has been going on for.
Right.
Give me a rough idea.
OK, take care. Bye.
Yes.
So they haven't written to you because you've got one. They've written to you and thousands of other men of your age to see if you've got one. Did you understand what it's talking about, this aortic aneurysm?
No.
No. What we'll do, why don't we draw a picture? So, my drawing's very bad, all right? That's your body. Okay? It's not a very good drawing. But your heart is here.
I think that's your legs, Richard.
Brilliant, well done.
And there.
Yeah.
There, that's where your penis is. That's where you leave from, and that's where Dr. Owen's showing you.
Exactly. So, this bit here is called the aorta. And normally it's nice and straight like that, like a railway track. Sometimes it can swell up a bit like an orange, and it bulges out. And this is what is called an aortic aneurysm. What they've done is they've written to you to get you to have a scan that just looks at your aorta in your tummy. So it's not saying that you've got an aneurysm. It's not saying that you need an operation for it. You said your dad had a problem with one, did he?
Yeah, because he had the operation, and 2 weeks after he died.
Did he?
Because he had a blood clot on the heart.
Okay.
Yeah.
He had an operation on an aneurysm, did he? Did he? Okay. But just because he
had a blood clot there.
Did he? Yeah.
So,
yeah. After operation, sometimes people can get blood clots, unfortunately. But just because he had it, it doesn't mean you've got it. Rich and Teresa, they have different needs from a lot of our population. From my point of view, I see my role as helping them negotiate the health service in order to use it effectively. Richard, they're not going to do any operations on you. What they're talking about doing is putting some jelly on and having a look. You know when pregnant women have their babies looked at?
Okay, I'll be with you.
Oh, is it the same thing?
It is, yeah.
Oh, right.
It's what's called an ultrasound scan. Okay.
It's
Pressure
nothing
off
to
that
do with
area.
your stomach, is it?
No, it's nothing to do with your tummy being big. Okay. Sometimes, if you're very thin, we can feel them, but I think you're a bit too big for us to feel it. I can try and feel it if you like, but it's quite hard to. If you've got a bit of fat on your tummy, we often can't feel it.
Doctor, don't say that. He's trying to lose a lot of weight, is he not, Sarah?
I'm not overweight.
Yeah.
No, he says, look, he's laughing.
I'm not laughing. But you know your tummy's bigger than mine, isn't it? Yeah.
Yeah, but it's not that.
He does go to the gym a lot.
That's really good. And going to the gym helps stop things like this. Yeah, that's really helpful.
Can we give you some medicine?
Yeah.
You sure?
Yeah.
Okay, good. So, eardrops, have you had much success with over the years?
No.
No, okay.
Getting anywhere near his ears
Yeah,
is...
so I think, you know, the swab should just give us the bug and hopefully which antibiotics it might be sensitive to.
You're a good boy, aren't you?
Mummy.
You let the doctor look, didn't
Mummy.
you? Yes, Matthew.
Down.
Down?
No, down.
Dance?
Yeah.
Are you a good dancer?
He's
Are
addicted
you?
to Strictly Come Dancing at the moment.
Oh, I'm addicted to Strictly Come Dancing. Who's your favourite?
Football.
Football?
Football?
Yeah.
So who's your team, Matthew?
Fulham.
Fulham?
Yeah.
Excellent.
Fulham.
Fireworks. Kitty and fireworks.
Yeah.
Your favourites?
Yeah.
Fireworks night's coming up.
Yeah.
We went to see some fireworks last night, didn't we, Matthew?
We're going to watch some fireworks tonight.
No, I'm going to watch the FA Cup.
Oh, sorry. Got the wrong pastime.
Well, yeah, fireworks are for kids, aren't they?
Yeah.
Did you do anything for like fireworks last night?
No, I was too tired. And it was too cold.
Yeah, that's true actually.
I haven't been to a firework display.
You wouldn't believe what my brother's dog did. They were out. This is last year. A hole through the door. I'm not joking. It's terrible.
When did you get her?
She's 3 months now.
Really? And she's a hearing dog, is she?
Yeah.
No?
Yeah.
No.
She's an everything dog.
An everything dog.
Diabetic dog.
Okay.
So she needs a step
Really?
to cover.
Yeah.
Very clever.
Brilliant.
Almost as clever as you. Have you got a dog?
No.
I
I don't want one. Okay.
Too pain.
What pain? Really? Tell me about it.
My heart. Because I walk in her all the time. It makes me twat. And the walking with her.
Are you getting it every time you walk her? Yeah. Will you take off your shoes and I'll have a look at your feet and your legs? Okay. Let's have a look. And is there any pain when I'm feeling your legs? Does that hurt?
Down the back.
Yeah. Okay. I can feel some veins there, but what we always wonder about is that we know your diabetes isn't very well controlled.
No, I'm on the wrong insulin. This is why I'm waiting for the referral to go and see the
And I'll ask about that. That's fine.
I sat in an empty waiting room for over an hour. Right? I couldn't get out of the chair. I can't sit down for very long. Right? I am not a moron, and I don't like being treated like I've got half a brain. I haven't got half a brain, I've got a whole brain, and it functions beautifully. And when I said to him, why am I an hour late? And I did do that. Why am I an hour late? And we take a longer time because we care. I don't give a toss who you care about. Do you know what I mean?
Yeah. It can't be that people are upset by every interaction you have with our surgery. That's not fair.
Could you have a look at a mole I've got that's behaving a bit funny?
I've got burns.
Okay.
And then I have a mole here. It's just a bit scary.
Right, how long's that been there?
Over a year.
You can just feel it, can't you?
Yeah.
So it's quite rough in texture, isn't it?
But anyway, you might be able to see it.
Oh, this.
This is.
Just looking at it, it doesn't look like anything sort of overly sinister. I can reassure you that this is not a sinister type of mole.
This is a freckle, very unlikely ever to cause you a problem.
The things that we do look for in moles, we have an ABCD rule. We look for any asymmetry of the mole, so anything that looks a little bit irregular, any change in the border of the mole. C would be for colour change, so if you're getting darker patches within the mole, then that's something to worry about. D is for diameter, anything that's more than about 6 millimetres. E for anything that's evolving, so anything that's itching, bleeding, anything that feels like it's changing, always come and get that checked out.
Yeah.
OK. Have a good rest of the day.
Great, you too.
Take
Great.
care.
Thank you.
Bye.
What were you thinking we might do about this pain?
Tramadol, actually.
Really? Just painkillers?
Yeah.
We can certainly go with painkillers, but we need to be cautious with you because you are at risk of getting problems with the blood supply to your legs. If you get any chest pain when you're walking, or if you're noticing that when you walk a certain distance you get pain in your legs that settles down when you're resting and then comes back when you start walking again, it's very important that we do get a vascular surgeon to see you to check on the blood supply to that area.
Does it look like it's got to reduce blood supply?
No, not significantly, but actually...
Don't tell me significantly. Does it, yes or no? If it was your foot, would you take it somewhere?
Part of my job is to manage risks. I know that you're at a high risk of having problems with your blood supply because of your diabetes, okay? So it's nice to want definite answers from doctors sometimes, but we can't always get them. It's not, is it?
No,
exactly.
it's just based on the opinion of the individual.
When you came last time...
Oh, God,
Why do you say that?
I'm very flexible. I come here, all I come here for is to get my medicine.
Yeah.
I
There's flexibility on both sides.
Exactly.
All right? I'm very flexible with you,
Yeah,
okay?
you are.
What I would say is, doesn't matter what profession you work in, if someone shouts at you when you're trying to do a good job,
No,
it's
she was
terribly
talking-
upsetting.
Right. The reason why I knew that she was talking is that all your muscles here move when you speak, even if you don't move your lips.
I'm
I am
sorry,
deaf.
you've obviously had...
I am not stupid. I have an IQ of 156. You know, I don't want to be, and how are you today? I could just feel the hand patting my head. No, you don't talk to people.
All right, well, we'll leave it.
And this, you know what I feel about that.
Yeah. Do you know, when I see you, do you know probably on average how much time I spend with you?
I know.
Yeah.
I don't understand and yet I'm grateful for it.
These are just normal people. We're all normal people, but it just worries me the regularity of it. Abuse within the NHS, I think, is taken very seriously in every practice. But the aim isn't just to tell people off, it's to try and work out why they felt the need to react in that way. And usually you can work with people and find a way forward with them.
It was because I was so stressed. I will apologise to him.
Did you?
No, I will.
Okay.
But I will apologise. And as I
We'll
say,
finish now, all right. I'll get that fine. I'll find out what's happening about that diabetes appointment. Come back and see me in a month.
Month.
Yep. And we'll see how your legs are doing. Right.
I am sorry.
Do doctors get ill? Like,
Yeah.
like how? They're doctors. Can they just? It must be so weird being a doctor going to the doctor. I think I've had this conversation with you before.
How was your holiday?
Oh, it was lovely, thank you. Very nice. We went to Snowdonia and did some walking. Came back and got a bit ill again, unfortunately.
A doctor got ill?
Yes, quite a bit.
Oh, that's no good. Are you better now?
A little bit, a little bit. I'm usually very well. Last time I was ill was the swine flu, so...
Don't go on holidays. It sounds fatal.
Hi. Hi, come on in. Right, so you're here for a refit of your implant.
Yeah.
Perfect. So, is this the first one that you've had in? Yeah, and you've been really happy with it as a method?
Perfect. Absolutely amazing. Couldn't last for better. Yeah,
Brilliant.
really good.
And have you had any side effects from it?
Not at all. The first couple of months, I think I was told it has to regulate out.
And then you've just had no periods
Nothing.
for the last 2 and 40
it's been
years.
perfect, and I suffered
Brilliant.
really badly with cramps and everything beforehand, and it's just completely eradicated the whole thing. I haven't had anything, so it's been great.
Fine, so it won't be painful at all. Taking it out can be a little bit fiddly.
Okay.
Because after 3 years, the body can put some fibrous tissue around it as a little sheath.
Yeah.
Are you happy to get on with it?
Yeah,
Is it
absolutely.
left or right arm?
I'm in here.
You've got it in your right arm.
just
Okay.
there.
Hopefully that would be straightforward to get out. So what we need to do, I pop you on here. So I'm just going to get everything ready on the trolley. The first thing I'm going to do is just do the local anaesthetic injection. Well done. And once this starts working, you won't feel anything else, I promise you. You will be able to feel me touching you,
But not pain.
but you won't be able to feel pain. Okay. So, can you feel anything? Wow. Just releasing the little capsule that I talked about that can form around it. It's out. That's pretty quick.
Oh my goodness.
And I can put the next one in.
Okay.
And you will be done. Just put it on a little pathway just along the side of the original one.
Okay.
Done. Finished. That was really straightforward. You did really well. And this will last you another 3 years until you come and have your next one in.
Come in. Hi there. Mr. Gomez. Hello, sir. Come on in.
You don't know about me, do you?
No, it's the first time we've met, so no, I don't.
I've been a patient here for a long time. And I've discovered that I've had cancer, liver cancer, a couple of months ago, but it's very bad. It's beyond surgery, so I'm going in towards, I think, the end of this month for the chemo. It's going to be a chemo Christmas.
Right.
I live alone, and I'm really struggling with the pain of this. It's extremely painful. It's those I'm taking. They're supposed to be every 4 hours, but I can take them every 1 hour, up to 1 hour if I want them. So I'm taking them every 1 to 2 hours.
Okay.
Sometimes I take them 3 and on the trot, 1 hour on the trot. And then something, but I try not to, because I don't want to build up too much tolerance, because when I get to the end of all this, I'm going to, I'm going to end up taking buckets of it, and I don't want to do that. I've been in so much pain for the last couple of months.
And where is your pain at the moment?
Oh, it's all in this region
On the
here.
side of the liver. Okay.
Yeah, it's all in that region just there.
Okay.
I can't do anything like cooking, getting up, and the other thing is, look, it's my legs. This is all like water. She said it's water.
It does look like water, tight, isn't it?
My feet are like loaves of bread. I can barely get my shoes on. Yeah.
And sometimes when you have problems with your liver, the amount of protein in the blood drops, and then the fluid is just leaking out into the cells, and that's where you get the swelling.
Yeah.
So the idea, I think, probably behind the chemotherapy and all of those things is to reverse some of those side effects of the liver problems.
I hope so. It's I don't know. I don't know. See, I'm on my own. I'm taking care of myself.
Right.
So it's very difficult,
Yeah. Have you got any other support around?
At the moment, that kind of support, I don't want that support,
What kind of support?
Like coming around and cooking for me, cleaning for me, doing it. I want to do that myself until I can't do it again. I've got liver cancer, not brain cancer. You know, I can still function, and I want to do that. Every day's precious. I don't want to give it up. I don't want to give up responsibility. I want to go down to the shop and get a loaf of bread.
Yeah.
You know, I want to touch it before I buy it. You know, is it fresh? You know what I mean? And I want to do these things still, and I don't want to take that away from me yet.
No.
You know, that's all I've got really. You know, the little things in life, which are the valuable things in life.
Precious.
You know, just take the dog for a walk on Wimbledon Common with the boy. You know, there's lovely little precious things. But you can't do it if you're in agony.
How long were you in hospital for?
2 weeks.
2 weeks,
Yeah. They took me in. They said, your bowel's ruptured, basically. I've been walking around with a ruptured bowel for God knows how long.
And how are you managing now that you are home?
I'm okay. My belly's a bit of a mess.
Okay.
And I've got a bit of a hole here.
Okay.
I'm just worried about, because I wasn't told anything about Crohn's disease. I don't know what to eat, what not to eat.
When you've had part of your bowel removed, your bowel absorbs nutrients, and so depending on what part of your bowel has gone, you need to make sure that you're getting all the nutrition.
Hungry all the time. Is that normal?
It can be. It's a big thing for your body to go through, and your body will be working harder, helping to heal everything up, and your calorie demands will be higher. And how are you doing? A lot of people struggle at the beginning with just how it all feels and looks like. How are you?
I haven't got a colostomy.
Have you not?
No.
Oh, I thought you had a colostomy.
No, I just missed it.
Oh, I didn't know that.
Just missed it.
Wow, so they resected your bowel and then...
I'm really lucky, because I think I'd just die if I had to have one.
I thought you had a colostomy.
No,
okay.
That's why I'm worried about what I eat, because that surgery could happen again, and I don't want one.
You're doing an amazing job.
Thank you.
So far.
I don't have very long, and I don't know. I'm going through all kinds of negativities. You know.
About the chemotherapy.
Yeah. Once I'm in there, I'm wired up. That's it. They got me.
Part of my job as a GP, we deal with people who have terminal diagnoses, and it's always upsetting to be with someone who is going through those stages of life. You have to try and keep that emotion to yourself, and make this the interaction about them. What are you worried about? What worries you? The agony of
it. I know
the pain there.
I know what's coming. Yeah, I already know what's coming. I can feel it. But with the chemo, I can possibly push me up to a year, maybe beyond.
I'm always impressed by how people find resources within them to face the final days or weeks bravely.
I've got a severely disabled lad. He's blind. You know, I've been his sole carer for the last 16 years.
Right.
It's my son. Yeah.
Yeah.
And I need to prepare him because he's acquired brain damage. You know, he needs to be prepared for this one. You know, we protected him when his mum had cancer, and she died, and he was in a mess. You know, so now he's going to have no one there.
Does he have any carers or any?
Oh yeah.
He's got people around him.
Yeah, he's with guide dogs. You know, he's got the guide. So
there's all that worrying you.
His welfare, his mental state. That's what worries me. Yeah.
And what kind of support, ideally, do you think he would benefit from?
Well, that's what I mean. I want about a year to sort of watch it. You know, I need a year to get him prepared and to be prepared to be on his own now.
Yeah.
You know, there's things I need to settle and take care of. Yeah.
If you have a think, and if there's anything else you think you need help with, or we might be able to help with, could you just give us a shout, and we can work it out.
Yeah.
I'll give you the amounts, more of these both.
Oh, the same again. Yeah.
I'll give you a bigger volume.
Yeah.
So that it doesn't run out.
Because I need to get this under control.
Yeah.
The management, the pain management. Yeah.
The pain we will get under control. The pain will get sorted. All right. Nice to see you. Give me a shout if there's anything else.
Thank you very much.
All right.
Thank you.
Take care now. Cheers. Bye bye.
Come in. Hello, how are you?
Okay.
You're wearing glasses. Oh dear.
This is just this morning. Sunday was kind of okay. It was a bit swelling underneath, and then this morning, swelling even more than this.
So it's got better throughout the day?
Yeah, a little bit. I did take an antihistamine in the morning.
And do you think the antihistamine's made much of a difference?
Not really.
And then, is it very itchy?
It's not at the moment.
It's just very puffy and swollen, isn't it?
Yeah.
And you're not wearing any eye makeup or anything like that?
No.
Poor you.
I'm also concerned that, the flaky skin bit kind of seems a bit yellowy.
One of our doctors does have a special interest in skin. Let me see if my colleague's available, just to get a second opinion.
Is it just on your face?
The swelling is, yeah.
If we give you 2, so we give you the 1% hydrocortisone.
Yeah.
Use the stronger one for a couple of days.
Okay.
Just to get it down, get some of the swelling down.
Yeah.
You're going to have to moisturise well, because as soon as that swelling has gone down, you're going to go wrinkly.
Yeah, yeah.
Which is horrid. What job do you do?
I'm a teacher. I've got parents' evening tomorrow.
Oh dear. Do you feel sort of anxious or worried?
I'm not sleeping very well at the moment. Which is very unusual for me. Like, I wake up all the time.
I'm still not sleeping properly. I haven't gone back to work yet because I've got another certificate from another doctor.
Okay.
And I prefer to have another couple of weeks off so I can get my head together and think what I've got to do.
And the problem with sleeping, I don't get sleep at all. Maybe because of the stress, the workload, what I do could be the reason. And tiredness is for the last 2-3 months. I'm really, really tired.
I mean, this kind of gives a good description in some ways of what you've been experiencing. You're finding it hard to kind of see the light side of life and not enjoying things as much as you used to.
That's been quite a stressful few months.
It has been a stressful few months. I can't get through the day. I'm kind of worried.
But small steps, because you've come a long way.
Hiya. Come through, Tony. How are you?
Well, thank you.
You look great. Like the trousers.
Thank you.
They're fab.
Back at uni, so...
Oh, right, OK. What course are you doing again?
English literature.
Right, yeah. I got a letter from Dr.
Ducci, yeah.
Yes. And you're on a waiting list for psychotherapy?
Yes, I'm currently seeing Dr. Healy at the Wandsworth Complex Needs every 3 or 4 weeks.
Right.
When I first found out I was diabetic, it definitely really threw my mental health, and I think I definitely wasn't coping for a period of 6 months, and I think I've got over that phase of, I think it's called burnout, when you stop testing and you stop really trying to look after it, and I think I'm testing 3-4 times a day now. I'm really trying to get a control of my blood sugar.
Yeah. Whenever a young person, particularly that has had a mental health problem, gets a diagnosis of type 1 diabetes, it's a very difficult combination. I haven't seen you when you're unwell with your mental health. And Dr. Ducci's indicated that you've had some really difficult times in the past.
I lost my mum when I was young, and I was initially born in South Africa, and now I'm at 15 social services intervened, so I've pretty much looked after myself since I was 15. So that's probably a lot of the issues. It was very early independence.
And were you very vulnerable at that time?
I think so. I think asking any 15, 16-year-old to look after themselves is a big thing, but I wouldn't have changed it because I'm here where I am now. And
brilliant.
Yeah.
I know from my experience of being a patient how much courage it takes to come and sit in the chair of a patient. It would have been about 15 years ago. I had had an eating disorder throughout medical school, and it happened at a time when I was a single-handed GP running a practice on my own. I had 3 children under 5, and I was working very long hours with very little sleep. It was very difficult to sit in that doctor's chair day after day, year after year, telling people to look after themselves when I was crying out to be looked after myself. I think you're very self-aware and you're obviously resourceful, built self-reliance, but just let people in as well. I went downhill pretty quickly until one day I could only get halfway to work and decided I couldn't do it anymore. And that's when we called our own GP and asked for help.
Is that everything?
Yeah, I think it is with me.
Yeah. Have a good day.
Thank you very much. Thank you. Bye, Tony. I've come through. I'm able to truly accept that illness is not your fault. And doctors are patients too sometimes.
Sometimes if I would feel a bit depressed, I would start punching up a wall. Instead of cutting my wrist, I would do that rather, you know.
I got to the stage in life when doctors are looking young.
Okay, all right.
Oh dear, sadness.
I was obviously clinically depressed, like, you know, this isn't just low times. We're talking, yeah, pretty bad.
And when you faint, do you actually sort of lose consciousness, or do you just go to the floor?
When I fainted, I knew what was going on because when my friend said you're going yellow, so I got to the floor and then I fainted.
Good morning, Putney. Naomi speaking.
Yeah, just to let you know, it's a teaching appointment, so there's going to be a student in the room.
At the moment, there's nothing I can book in advance.
So what's your date of birth? And what's the name?
Hans, morning. Right, so what's happened in the last 10 days?
Well, I can tell you what's happened this morning. Very depressing for me. I ran upstairs to the toilet, but I had an
accident?
Yeah, an accident.
Loose or?
Yes, it's always very soft. I don't have any constipation. What I have noticed on the pan is the stuff was going not down, but up and sideways.
Right.
And it was on my cheeks too.
A bit of splatter.
Yeah, I've never had that before. March this year, I had an accident in the kitchen where, you know, luckily it was on the lino, but, you know, it's pretty disgusting, isn't it?
Right, okay, so you had all those blood tests done and kidney function's normal, thyroid's normal, liver is completely normal, kidneys again are normal. Okay, we're going to have to feel the back passage, I'm afraid, Hans.
I feel sorry for you. Would you want me to take trousers and pants?
Oh, just pull them down. You don't need to take them off.
Yeah. I do get some on the side of the pants, some hard, dark blacky brown spots, and they're very hard to shift. I have to get a scouring pad. I can't flush them away.
Right,
They're very
okay.
sticky.
Roll onto your left side.
Left side, sorry.
That's okay.
There we are.
You get a bit of itching down here, don't you? The skin's at the back is just a
Yes,
little bit
yes.
abraded.
Well, I suppose that's because I've been rubbing it, especially this morning.
Okay, little pressure, shouldn't hurt.
Yeah. Oh,
There's certainly no blood there.
good.
And no lumps.
No lumps. So it's not piles or hemorrhoids.
I certainly couldn't see any, and
And there's no mess in the passage at all?
no.
It's funny, since you've done your examination, I feel I got an urge to go to the toilet again.
It's not uncommon. You may have to go, yeah. But it's not been diarrheal.
It comes out stringy, like about the size of my index fingers, curling round, you know. And then I've had soreness.
Is it itchy at the moment?
No.
No. I don't have any strong alarm bells about any of this at the moment. I think we're going to wait and see for 3 months, Hans.
Right,
But I haven't got any magic medicine at the moment.
If there are any more problems, I'll come back. Thank you, Doctor.
Okay.
I woke up like this morning. Yeah, I have very bad teeth. I'm ashamed to say. There's stubs and everything. And I don't know whether that's what's done this to me.
So it's all swollen. Is it painful?
It's not that it's painful, it's just more awkward.
Okay.
You know, to try and open my mouth. And I just... I'm so upset. Is there any way I could go to a hospital and get these teeth out?
You can, but that your dentist will organise that.
I haven't actually registered with a dentist here.
You'll need to see you need to register with a dentist.
You see, I'm terrified of needles.
Don't worry, that's all right. We're here to try and help. It may be that we can give you some antibiotics. That's what we could do, really, to let it settle down while you're waiting
How long
to
will
register.
that take?
It probably is just a dental infection, and antibiotics will get on top of it quite quickly. Let's have a little look at this mouth, and I'll have a look in your ears. You open up for me. Yeah, it looks like there's something quite nasty going on at the top there.
Sorry.
All right. When I did look inside this lady's mouth, it wasn't a particularly pretty sight. It was pretty appalling. Some people just have a sort of almost a phobia. It's difficult sometimes getting people to access the treatment they need. You just have to take them through it, really. What we need to do is get you started on some good broad-spectrum antibiotics to get on top of that, but that's all that we can do, really.
You see, I'm so terrified of needles, that's why I don't go to a dentist. I know it's stupid.
If they want to do anything, we'd be happy to prescribe a little bit of sedation for you to have some procedures done.
I need to be knocked out because, I mean, they're in my gums, you know.
Yeah. OK, you're not allergic to penicillin?
Not that I know of now.
So this is a week's worth, 3 times a day. That should get on top of it quite quickly.
OK.
All right.
Listen, thank you very much.
It'll settle down with those antibiotics. It really should, but obviously it needs more than just antibiotics. All right, OK. All right,
Thank you very
no
much.
problems. Bye now.
Bye.
You not any medication? Well, why have you got to have a medication review then?
Hi, oh, gosh, hold on one minute.
Do you smoke?
I smoke a tiny bit.
And how much are you smoking at the moment? I'm a detective.
Yeah.
One day when I sort of put my hand out, I had a cigar there.
Yeah.
And I thought, I don't remember lighting that.
Is it all right to ask you some questions in front of your mum? Is that all right?
Probably.
Do you smoke?
No.
No, OK, all right.
I'm Dr. Mackenzie. We spoke on the phone last week.
Yes, we did.
Same problem?
I have restarted my antidepressants after a 6, 7, 8 odd week break.
What is it you take?
This is it here, if that means anything to you.
Yeah, and what dose do you take? One of these a day?
No, I'm taking 2 of those a day.
Right, okay. Does it work?
There's highs and lows.
Mm-hmm.
To cut a long story short, now I'm going to start.
Mm-hmm.
So, I need to get onto something that's going to give me my life back, because I'm not. It's not happening. I'm not enjoying. I'm not living. I'm not anything.
Good morning, Putney Mead. Rachel speaking.
We don't have anything for tonight, unfortunately. We've only got mid-morning by the look of it.
No, I don't have any today, sorry.
OK, just bear with me, I'll have a look at it. Unfortunately, no, not at the moment, I'm afraid.
So that's with Dr. D-Man, 5 o'clock.
Come in. Hi there, hi. Come and have a seat. So Ellie, is that right?
Yeah. Ellie was going through really dizzy spells and just feeling absolutely ghastly. And we ended up at the Cromwell, because she sort of did this dramatic collapse in the waiting room. They ended up putting her in an MRI. But we ended up at an ENT specialist, and he thought it was just really bad labyrinthitis.
Okay.
She couldn't move. And ever since then, we've had continuing episodes. Normally it's just sort of a day here and there, but this last week has been really awful. She feels so dreadful. She's just miserable.
Yeah. So do you want to just explain to me what it feels like when you...
It feels really dizzy, and sometimes I feel sick and nauseous.
Have you been sick with it?
Yes. No, I haven't been sick. I just feel nauseous and really yuck.
And have you had any fever or sort of coldy type symptoms?
I get the often cough, but I don't think it's like a fever.
And is it does movement generally make it worse? Yeah, so that's why lying down helps you to...
She just wants to lie, and then we can't get her up.
Yeah, but then when I lie down, I can't really get up because I feel so dizzy.
Dreadful.
Yeah, I can't move.
So I'm just going to take your temperature. And any headaches at all?
Yeah, I've had a couple of headaches, like really bad ones.
Do you want to describe the headache to me?
Sometimes it feels like somebody's like ringing, the church bells. It feels like I'm like right against one. And sometimes it feels like there's somebody hitting me, and it really hurts.
Mm-hmm. And when you faint, do you actually sort of lose consciousness, or do you just go to the floor?
When I fainted, I knew what was going on because when my friend said you're going yellow, so I got to the floor and then I fainted.
I'm just going to ask you to follow my finger with your eyes, but keep your head still for me, okay? So, and just tell me if you see double, okay? Okay, that's fine. From what you're describing, it sounds absolutely like a sort of inner ear sort of disturbance. What we could try would be some regular Stemetil.
Does Stemetil help the dizziness or just the nausea?
Both.
Okay, all right.
Yeah.
Okay.
Then if things aren't settling or worsening, then I think it would be reasonable to seek the ENT's opinion.
Sure. Can I get a referral letter from Mrs.
That's fine.
Benjamin?
Yeah,
Is that all right?
That's fine, and I'll do that, and I'll leave that at the reception desk.
All right. Sorry.
Okay.
Thanks. Thank you. Have a good day.
Okay, and you. Bye then. All right.
When did it all start not to be right?
Many years ago.
Mm.
Many years ago.
5, 10, 15, 20?
Triggered with children.
Yeah.
Triggered with the birth of the children.
So there was some postnatal depression?
Postnatal, definitely. I was obviously prone to it. It's depression in my family. We're clinically depressed. Like, this isn't just low times. We're talking, yeah, pretty bad. Yeah.
Dramatic things?
I think so.
Suicide attempts?
Not attempts, thoughts.
Thoughts, okay, fine.
Which is a step up.
So psychiatrists you've seen?
Yeah. I've just got this deep-seated depression. I just don't know how to get out of it.
Mm.
I really don't. And you know, the kids are suffering with my moods, my this, my anger, my aggression, my everything. So it's not a very nice spot to be in.
Okay, so I think
Very difficult.
the situation at the moment is certainly not to rock the boat. I think we certainly don't want you to run out of your medicines. You've had 6 weeks off.
Yeah.
And that doesn't seem to have helped. You know, so we'll give you a prescription for another month of that, and then we need to talk again. So there's enough there for 4 weeks, 2 a day, so that's the 40 milligram. So if we can meet in about 4 weeks' time, the children, boys or girls?
One of each.
Right. I want to see you before those tablets run out, so about 3 to 4 weeks up the road.
Yep.
And you can come back sooner if things were different or worse.
Okay.
Okay. Bye for now.
Bye.
It's NHS, they're up to their eyeballs with appointments for sick people.
I'm going to be doing some very basic stuff: height, weight, blood pressure. You're a gentleman who has quite a few health conditions.
Yeah.
Yeah.
But I feel perfectly fine.
Which is brilliant, and
Thank
we
you
want
very
to
much.
keep you that way.
Yeah.
So to give you a little bit extra time with a doctor to make sure that I'm just looking at your face and you're not saying ugh, but it's to make sure.
No, well, I've got a problem straight away with that.
What's that?
This. In September, I asked for a book.
Right.
She went to her cupboard. No, I haven't got one. So she wanted to give me the other book.
Right.
Which I can't get on with.
Right.
Now, that lady could not walk next door to get one. So this is my problem when you're talking like this.
Right.
You imagine if I've been seriously ill or someone had been seriously ill and she couldn't be bothered to go next door. Yeah. She shouldn't be in the job, personally.
Right.
Nothing against yourself, but when you're going on about all this, and I've had an experience of that,
yeah.
I don't think it's very funny, like, personally.
No.
Sometimes you feel like you sort of, well, does anyone really care anymore?
Right.
Hi, Mr. Walker. Come in.
You are a very lucky man.
Why is that?
Just about ready to get away.
Were you?
I've been waiting here over an hour.
Yeah, I'm really sorry. I've just been...
It's no good, it's not good. Very annoyed. Carry on.
This has been going on since last December, and I've had enough.
But how long is it going to be? You know, I'm going to be dead by the time I see them.
Yeah, okay.
The service has gone downhill, personally. That's how I felt.
Yep. Yeah.
And the only other thing I've got to think of, I'm not happy with the book.
Come in. Hi there, hi. Lost your voice. Yes. Have a seat. I'm Dr. Rose, by the way, I don't think we've met.
No, I don't think we have.
No.
So I don't know whether you've had a quick look, but it's an ongoing condition.
Okay.
So I've had 7 operations
Right.
over the last 7-8 years.
Mhm.
I've got another one due in 4 weeks. But it never usually gets as bad as this before an operation.
Don't you just explain to me the history?
Yeah, so it's the HPV virus on the vocal cords. The first time it happened, they cut them away, analysed them, it's all fine. And it was quite a while before they came back. And then this year, I've had 3 operations.
Right.
So it's quite aggressive at the moment.
Yeah. And other than the sort of loss of voice, do you get other symptoms with it? Is it uncomfortable or?
It is at the moment, because I'm having to push words out, I think.
Yeah, so it's
Because when I try to talk, there's nothing coming out at all. And it's
quite exhausting.
It is.
Yeah.
And I'm having a few issues with work because I work for a university, student inquiries, and I can't answer the inquiries.
You can't answer the inquiries at the moment.
No, it's just getting quite impossible, really, to carry out my job. Really, I'm just asking whether it would be possible to be signed off until the operation.
We'll just have a look and see. Don't open your mouth up nice and wide for me. And say, for me.
It's not in the area that you can see. It's further down onto your vocal cord, so you can't actually see anything there. Okay, no fever or cold or cough or anything like that. No. Okay. And it doesn't seem that there's much choice really if they can't bring the operation forward and work can't find anything else for you to do. It doesn't seem that it's fair for you to continue working. So I send you off to the Monday following the operation on the Wednesday. Maybe it goes all right.
Thanks. You'll be used to it by now.
How long have you been on the HRT for now?
2 years?
Okay.
Yeah, 2 years.
And what symptoms did you have before you went on it? What was the reason?
Oh, well, I went to my gynae, who I
Right.
see every year. He's known me since he produced my last child, who's 23 years ago.
Okay, all right.
And his expression was that I'd hit the buffers in my
Right.
life.
Okay.
And he said, I've got some magic potion for you.
Right, okay.
And this was it, and then indeed it has been magic.
Okay.
You know, he put me on this and I haven't looked back.
Are you having any periods at all?
No.
No. And
Thank
so
God. Those days are over.
Oh, right. And what did he explain in terms of the risks and benefits of...
Lots, explained everything. I do have mammograms.
And they've been normal?
They've been normal.
Can I do your blood pressure? May I do that?
Oh, crikey. Yes, I'm just about to play tennis and
Right.
all sorts of things. And...
When you're on HRT, we need to keep a close eye on your blood pressure as well.
Do you? Oh, okay. I didn't realise.
So, nice slow breaths and then we'll... Okay. It's not very high, but it's certainly not kind of in the low in your boots.
All right, okay.
But I think given that you're on HRT
Yes,
and we need to keep an eye on it.
yes,
I guess the question then to ask is how long do you foresee taking this for?
I'm not a drug taker.
No.
Do you know what I mean? I don't pop pills unnecessarily. So, I mean, it's just, I know it's there. It's my little crutch.
It's your crutch.
Yeah.
Okay. Well, can I suggest if I can give you 3 months this time round,
Okay.
and then we could have a follow-up discussion about that, so making a plan.
Okay.
Is that okay?
Yeah, perfect. I got to the stage in life when doctors are looking young.
Okay, all right.
Oh dear, sadness.
Well, nice to meet you.
And you.
And then we'll touch base, as I said, in about a month's time.
Oh, yeah, all right.
Have a nice
Nice
day.
to meet you.
All right,
Bye.
bye-bye now.
Oh, a pink sticker. Have you had a flu jab? Very good.
And how are you feeling since all the events with all the bleeding?
I'm kind of lucky to be alive. What happened is I was driving
to
play golf, and from York to Chester.
Yes.
And I decided to fill up with petrol at the last petrol station just outside Chester. I know it very well. And I got out of the car. I filled the car up with petrol, and I felt a bit giddy. And I thought, oh, fumes from the. Went in to pay the bill, and that was the last I remember. Next thing, I was in an ambulance being rushed to the Countess of Chester Hospital.
This happened in the morning, and by the time we got there, which was about 5:30 in the evening, he was drifting away, he was fading away.
Goodness.
And he was still bleeding, purging blood,
Yes.
and they were pumping blood into him. And we were told by one of the doctors that some people stop bleeding and some people don't.
Put 6 pints in.
6 pints of blood.
6 pints.
His temperature had dropped to 60-something over 20-something. And he was drifting away, so I held his hand. I told him to keep awake, stay awake, stay awake.
And had you had any symptoms before any of this?
None at all.
So no pains?
No pain or anything.
Nothing like that?
Quite extraordinary.
Well, it is. I don't know. You've been very lucky, I think.
Have I?
Yes, because I think it sounds like it was a very scary episode up in
It was
Chester.
terrible, terrible. We almost lost him.
I wake up in the night because I just can't get any air into my lungs.
So big deep breath in, and then blast your air into there. 1, 2, 3, and keep blowing, keep blowing, keep blowing. keep blowing, keep blowing, keep blowing. Stop when you need to. Well done.
With hindsight, it's easy.
Yes.
The only indication I had that there was something wrong is that morning before leaving Yorkshire, I had to sit on the loo, and I thought I had diarrhoea because I was on the loo for a very, very long time. And without being too vulgar, I virtually filled the loo. And I thought, this is diarrhea. I didn't realise it was black blood.
Was it black?
He didn't tell. He didn't.
But I didn't, you know, I didn't think about it.
No. Shall I have a look at this wound?
Yes. Sorry.
That's all right.
The nurse is coming to take the rest of the staples out tomorrow morning. She's a fantastic nurse.
So they took out the whole of the tumour?
The whole of the tumour.
It's all out?
They had to take the spleen out as well.
Yeah, they took out the surrounding tissue.
That's right. I don't want to take this off because I think it's well dressed, but I can see around there it looks still a bit moist, but this end is healing nicely.
I'm on penicillin
now.
for the rest of my life.
So it's going to be lifelong, yes. Once this all settles, there's no reason you can't carry on doing things as normal.
Right.
You know, I think you just have to have a period where you're just convalescing.
The other thing we don't know, we haven't had the result of the biopsy.
No.
On the tumour as to whether it was, you know, benign or, yeah.
How are you feeling about it all?
Fine.
Are you?
Determined to get back fit, look after my wife. She's a very good nurse.
Yes, she is.
But I need to look after her.
Yes.
So.
Right, good. I would suggest we touch base once you've seen the master. Yeah. Okay.
How can I help today?
I came from France and I forgot my drugs.
So are you just visiting here?
Yeah, I'm just visiting. I'm a sort of temporary patient, and I forgot those 3 drugs. It's a statin and the aspirin, and then there's a blood thinner, but I don't know which is which.
Okay. Can we check your blood pressure now that I've got you in here? Are you just over here seeing family?
No, I had to get a new passport. My wife just died, and so I need to get back to America. She was American, and uterine cancer. Yeah, and so it's sorting out affairs and doing stuff. And I come over for a sort of a health check, but I'm sorry, this is unscheduled, you know.
Now, while we're doing that, let's do this again. Be nice and quiet for a moment just while we check this.
Oh, okay. Is it high?
It's probably because we're talking, so...
I had it checked about 2 weeks ago.
Now we're talking again and it's gone up, so nice and quiet. Sit back in the chair and no chattering.
All right.
So your blood pressure's 146/94, which is a bit higher than I'd like it. So just when you get back to France, get it checked again.
All right, okay.
But let's give you these medications. So aspirin, tenolol, and then there is suvastatin, one to be taken at night. Okay, it actually says on here, le soir.
Le soir, yes it does. That's your actual French.
I remember something from my GCSE days.
Yeah, well,
All right.
I didn't even look at that.
And don't take it with grapefruit. That's another one. Don't ever have grapefruit with your statin. It increases the risk of you having side effects like muscle aches and pains and inflammation of the muscles.
I have a grapefruit every day.
Oh, I probably would have
in the morning. I don't sort of have a spoon or cut it. I eat it like an animal over the sink. So very quickly, before I have my porridge and fruit and
not
stuff.
Not having grapefruit.
Oh, really?
Yeah.
It's bad for the condition, is it?
Bad for the statins because it increases the risk of getting inflammation of the muscles.
So that's the statin, is it?
Yeah, that one's
Well, I
the
take it.
statin.
I have a grapefruit in the morning, so the statin at night would be okay, would it?
I mean, the recommendations are that you don't have grapefruits.
All right. Well, I'll take that on board. Thank you.
Okay.
That's great. You've been great. Thank you very much.
No problem.
Thank you.
Don't forget your wallet.
Bye. Oh,
I'm going to take it as a tip.
Thank you. Bye.
See you later.
Is it itchy? No. Is it very tender to touch?
Yes.
Can you just twist the top half of your body and just go right round and then the other way?
So you come for your blood test, for your blood sugars. Just relax the hand.
Hello there. Nice to see you. Have a seat. Now, we've called you in for a global health assessment, I think, is something...
Well, yeah, I had to have a blood test.
Well, your blood pressure is certainly perfect. Your cholesterol is brilliant, so the tablets there are working very well. Kidney function's a little bit reduced from normal, but it's very stable. How have you been feeling in yourself?
Not all that, to be quite honest with you.
Mm.
Not all that. My legs play me up.
Mm.
And I do get a pain in the right-hand side here.
Yeah, that's to do with that arterial disease that we know you have. Do you mind if we just check your hips and legs out, if you pop in behind the curtain there for me? Just lie up on the couch and tell me about the dreaded cigarettes.
To be quite honest with you, I started again.
Right, well that's a little bit of a problem. We know the circulation in your legs is not great. There's a bit of a pulsation here, and certainly none further down. I'm just going to rotate your hip a little bit. Just tell me if it's painful. Okay, well they're both a little bit stiff, but the problem is still that circulation in your feet. Up you come. I think there's a good reason for asking a blood vessel specialist to have a look at you. I'll arrange a referral up at Queen Mary's, and we'll get that done fairly quickly. Date of birth is 1st of May, 32.
That's it, yeah. 82 years of age.
So during the last month, do you feel down or hopeless, depressed?
Yeah.
Frustrated?
Yeah. Yeah.
How big a problem does that get?
I just have to get on with it, don't I? You know, I used to go to my daughter's in Sussex, but I don't go now. But she phones me regularly.
Right. Does she come up here at all to see you?
Oh, yeah, but not like she used to.
No.
And I used to go down there quite a lot, but I feel I don't want to go now.
Yeah. And friends? Do you have any friends left of your age around?
Really, no, not really, no. A few of the neighbours I get on with.
Yeah.
But other than that, no. Don't have no friends. No.
It strikes me that your legs are a big part of interfering with your life and making you a bit depressed, really. Mm-hmm. And if we get Queen Mary's to do an assessment, and I think that if we can make your legs better, I think it'll make a big difference to you.
Yeah.
Hi, all right. Come
Yeah,
in, have
good,
a seat.
thanks.
Is it Wesley Stone?
Yeah.
Hi.
I'm going to South Africa for 3 weeks for holiday.
Yeah.
Yeah, so I just wanted to get a prescription for my paroxetine and Namictin.
So you take it for the bipolar, is that right?
Yeah, well, I was diagnosed with bipolar when I was, 16 or 17, but I was taking a lot of drugs at the time. So, I mean, I've been clean now for four years.
That's
no,
great.
longer, 5 years.
Yeah.
I gave up drinking 2 years ago, so I don't even drink. I used to get very aggressive for no reason before,
Yeah.
Sometimes if I would feel a bit depressed, I would go and start punching up a wall, and then my knuckles would be all smashed for a couple of weeks. And so instead of cutting my wrists, I would do that rather,
But we're not,
Yeah, but that's...
Things are a lot better, aren't they?
I mean, that doesn't even happen,
Okay.
So.
At the moment, are you feeling suicidal or like hurting yourself?
No.
No. Okay, well that's good. And it sounds like you've taken away a lot of the factors that were causing your mood swings, and that as a result that's become quite stable. Is that fair to say?
There's absolutely nothing wrong with him now. He never gets angry. He probably doesn't even need the tablets anymore because he's perfectly fine.
So we're in a better place, aren't you?
Yeah.
Have you ever seen a psychiatrist in England?
No, because I haven't really felt I needed to,
Yeah.
And that's the whole reason I changed my lifestyle over the last 5-6 years,
Yeah, and you've done a great job with that.
Yeah.
From what you're telling me.
Yeah.
So shall I give you the medications as you normally take them?
Yeah.
And maybe you can come back and see me after South Africa.
Yeah, that will be
good.
good.
And we can make a proper go at reducing these medications. Getting the psychiatrist involved when we need to. Does that sound all right to you?
Yeah, that would be good. Yeah.
See when we've got some appointments available when you come back, and we'll take it from there.
And then, yeah.
All right.
So I'll see you then, eh?
Yeah, all right. Take care. See you later.
Bye.
All right. Bye now. Bye.
Good morning, Putney. Maid Care speaking. How can I help you? Okay, hello?
There is. No, you're right.
She hanged up the phone.
Hi there. Hi. Mrs. and Miss Doyle. It's Miss Doyle we've come to see today.
That's right.
Right, this arm. Presumably.
Yes.
Still hasn't really gone down, but it's getting better.
I think it is getting better, isn't it?
The only reason we're
But
back...
it's very slow.
Yes, and it still feels quite hard underneath.
Yeah. Maybe that's 18 millimetres by 18 and a half. I said 20 by 20 last time, so I think this is settling down.
Do you?
It takes a long time, but it is a frustratingly long
Well, I'm
period of
happy
time.
if it's going. We're happy if it's
Yeah.
going.
Yeah.
I think she's had so many antibiotics. Don't really want her to have another course because she's had so many in the last.
Well, for this, I've had it for my ear.
Has come back with her mother, full stop. The area of inflammation is reducing. It now measures 18 by 18 millimetres, full stop. There is no fluctuance, so nothing to cut into, full stop. They are to return in 2 months if it has not fully resolved, full stop.
Because she's getting quite a few skin things, do you think some children are just predisposed to? Because you've got molluscums and.
You know, I think her immune system's trying to keep it under control.
Good.
But lots of people need a little bit of help.
So we just paint the stuff on, do we, and then it zaps it?
Cross fingers, yes.
Touch wood.
Touch wood, yeah, absolutely. That is the instruction. Okay.
Thank you, and thanks for seeing us today. Thanks very much. Thank you.
Bye.
Bye for now.
There's no hurry. Oh. There you go. Come and have a seat.
Thank you.
Oh. You're doing a bit of falling around the place. You've had about 4 falls by the sound of it.
And in fact, last weekend, I had to take her to the emergency, Princess Grace, because her ankle was all swollen and her leg was bright red. So I rushed her up to the Princess Grace and they'd given her a course of antibiotics because it got infected.
And is it better?
It's getting better. We've been coming here to have the dressing changed.
Yeah.
I have blackouts.
Yes.
But
And
the
they're very
last one wasn't a
painful.
blackout. I think she just lost her balance.
Yeah.
I've actually watched her and she sort of does that, and I think it's
Okay.
just a question of not
Balance.
having balance and
You
strength.
may be absolutely right.
Strength in
But
her.
it's funny that she sort of blacked out. Is that...
Well,
It doesn't tell me I'm going to black out. It just blacks out of...
I know. So maybe going to the Falls Clinic
Yes.
might actually be a sensible move.
I haven't got much longer, have I?
You've
At
got a
my
lot
age.
longer.
Well, the thing is, you can't depart
No.
from this earth by appointment.
No, that is
You have to do
absolutely
it.
true.
You have to do it when your
Yeah.
cards are up.
That's right.
So what we want to do is try and stop you falling over a bit so that you don't break anything.
Well, if you
I mean,
could
that would be
tell me.
that would be the worst thing you could do to break something and find
Yes.
yourself in hospital.
Yes.
She's got a care team starting next week who are coming twice a day and are going to take her out for walks and
Good.
give her a bit more confidence.
And that's helpful to you.
Very, very helpful because I'm completely exhausted. Her mind is getting quite bad.
Yeah.
Her confusion is very bad. Isn't it, Mummy? You get very confused.
But I'm very old. I'm 91. I mean, what else can I?
You remember?
Well, this is why your daughter's organised for people to come in and keep an eye on you, and
Yes,
which I think is very sensible. You know, your daughter's coming over. And she needs a bit of help. Otherwise, if she gets overtired,
Yes, of course.
then it's not going to help.
I'm not a young woman anymore, unfortunately.
No, you think she's still a spring chicken, but she's
40 something.
No,
That's a young.
No, I'm 65,
Oh,
Mummy.
really?
Yes.
That's the problem, is that we're all getting a bit older.
What can I do for you
It's
today?
only a stupid thing. My toes got infected.
So that's an infected and growing toenail, I
is it?
think.
Can we keep the toe?
You can keep the toe.
And about 10 days ago, I had athlete's foot. Now I'm faced with intense burning and intense irritation.
It's hot. My feet are hot.
So it's like burning like fire.
Mainly under my toes. You've got quite a lot of breaks in the skin. This may be a little bit of residual infection.
That's a little verruca. Don't worry. Does it hurt you? No.
This swelling you were pointing out?
Round there.
Yeah.
There.
Okay, okay. So,
Oh, I'm sorry, I've given you the wrong foot.
Hello.
Peter, hello there. Have a seat. Just trying to see when I saw you last. I think it was about 10 years ago. We've spoken on the phone since then, but obviously something fairly dramatic's happened. When did they formally tell you that it was lung cancer?
About a month ago.
I think you'd had a scan that was pretty suspicious.
I've had a scan, I've had biopsy.
Right.
It's a lot. I got fed up with it.
Right.
Really fed up with it.
Yeah.
Well, like chemotherapy, I didn't want to go through it. I refused it. Because I think they turn you into a zombie.
Obviously, without treatment or intervention, it's going to get worse.
Yeah.
The specialists wouldn't impose treatment on you that they thought had no chance of helping in some way.
I haven't heard of anybody having chemotherapy and all the rest of that survived. They all died.
Mm-hmm.
And even if they operate, there's no guarantee either.
No, you know, no one can. If people promised you that it would be okay, they'd be lying. So
I won't believe them.
Who's the consultant that you've been under?
Dr. Poppet.
So have you seen Dr. Poppet?
No.
No. Is there an appointment?
On Monday.
I can't see any use of seeing him.
It would help me a lot.
Would it?
Yeah.
Oh, well,
Because it's got to be a balance of the benefits against the negative effects. You know, if those side effects were short term, but we're going to give you another 3 years.
The side effects can make you vomit, lose your hair, diarrhea, and many other things.
Yeah.
I mean, I don't want to go through all that.
Well, you know, I can't make that decision for you, but I think that you shouldn't make that decision without having the input of a cancer specialist. You know, you're sticking your head in the sand a bit. The most challenging patients in general practice, I think, and those that generate the most emotion are situations where you can't make much difference to their outcome. By and large, though, the overwhelming emotion seen is of strength and courage. You've got the power, not me and not him. You know, it's your decision at the end of the day. But I think that we shouldn't make it without all of the right information.
If that's all it is, okay, I'll go and see him.
The pain, you don't need any painkillers?
All I use is Anadin.
You got right. a lot of prescribable medicines, but I think we'll wait and see what Monday brings. Okay?
Thank you.
Peter?
Yeah.
So it's been a long time, but I think we'll be seeing each other fairly frequently.
Are all doctors healthy as well?
No.
Thanks
Okay.
a lot, Doctor.
Yeah. Okay. Thanks. Bye.
Hope you're feeling better soon. Thank you. Okay. Cheers now. Bye-bye.
Well, good luck with your Spider-Manning, all right? You're going to sort all the baddies out. See you later.
Thank you very much.
Bye.
See you again.
Thank you very
Cheerio.
much. Bye-bye.